22nd year of the millennium. So maybe we get our meeting done in 2 minutes. I don't think so. I was thinking of conducting the meeting or requiring the meeting to be conducted only in Ukrainian in sympathy for our compatriots, but I figured that would be way too close or too short of a meeting if we did that.
2 minutes.
But we remember them sadly today. We do have 4 items on our agenda. If anybody doesn't have a copy of the agenda, I think there's some in the back there. But that's on the printed agenda. We need to add an item up front. And so, Chris, you want to introduce the first item, and then we'll jump into that and continue on through our agenda this evening.
Thank you, Mayor. And also, I did get an email from Kendra Shaw letting us know she had a last-minute schedule change, so she couldn't be here tonight. So she won't be joining us. I think joining us in person. I think she may be online, but I know she's not joining us in person. The change actually is John. We missed John, having John Felton, our health officer, give us an update on COVID. And since we finally have some good news, thought it would be nice to give him the time to share that good news with us. So if we can start with John, and then I think with a name like Arviskow, we should be able to speak Ukrainian.
Yeah.
Halski maybe should too, but I can't. So I'm counting on Steve. Carry us.
Okay, we'll turn it over to you, John. I don't know if somebody can put John on sort of the full-size screen. He's kind of on the little screen right now. And just remember, for all of our council members, our only microphone is the pizza box. So keep your voice up and direct it there. And for anybody who's speaking from the podium later this evening with comments, please direct your comments directly into the microphone. It picks up well that way, but it doesn't pick up if you don't project directly into the microphone. John, we can see you. Well, welcome.
Thank you, Mayor and Council. It's good to see you all again. As Chris said, we actually get to share some good news today. So I do need Kevin to let me share my screen, and then we can put good news up here.
Be good.
Go ahead, John. You should be connected.
Okay, let me get it full size. Okay, do you all see that full size picture? Yes. Okay, thank you. So I'm going to just walk you through some quick changes. So this is from a week ago. This is Valentine's Day. If you look up here in the upper left, this is national levels with 47 cases per 100,000. Here's Montana, 8th in the country at 78 per 100,000. So that for us is right around 100 cases a day. Don't worry about this state of where it says state Washington. It's because it's a screenshot. But you'll notice virtually the entire country is red, and then there is a few in orange over here. Oops. So here's yesterday, a week later. Montana is still at 10th, but we're down by about a third in terms of our cases. The nation is down by almost half. Lots of orange, and we're starting to see some yellow. So really a lot of progress. And this is the Omicron history. It goes up really rapidly to really high levels and then drops rapidly. When we look at the state of Montana, you can really see this. So here we have our 2 previous surges. Here's our Omicron surge. It went up over the course of about 4 to 5 weeks. Up to levels that were twice what we ever saw in the initial surge or the Delta surge, but it's come down really rapidly as well. Yellowstone County, actually, we've come down even more rapidly. Again, about twice the level of cases per day that we saw in either of our previous 2 surges. Interesting thing about this is when we watch these 2 surges, the 2021 and 2020 surges each took about 3 months to go up and about 3 months to come down. The Omicron surge went up much more rapidly and it's coming down much more rapidly. So there's a certain symmetry to these surges that we do see. When we look at these on a weekly basis of cases per 100,000, you can see that the Omicron level was almost double. anything we saw in the previous two surges. So 200 cases per 100,000 for Yellowstone County is right around about 230 cases a day. This is more like 160 cases a day. So really dramatic. Sorry, that's 320 cases a day. I had a little dyslexic moment there. 320 cases a day. But you can see just how rapidly this has come down over the course of a few weeks. When we look at Yellowstone County compared to the state, you can see that we're actually down only about 8% of cases in the state now. That's that gray line, or about half of our proportionate share. When we look at cases on a monthly basis, you can really see the effect of Omicron, about 50% more than the peaks of either of other two surges. But again, it happened really quickly and it's coming down really quickly, as we would expect. This is, I don't think I had this last time I talked to you all. This looks at the percent changes on a weekly basis. So anything is in red means the cases went up compared to the previous week. Anything in green means it went down. That 100% mark means that we doubled cases. So anything above 100% double. So from the week ending on Christmas, the week ending New Year's doubled, the week ending January doubled again, and the week ending January 15th doubled again. And then we hit that top where we were still increasing at a much lower rate, and then we started decreasing. So it's the 50%, that means our cases cut in half from the previous week. So a little less than half, more than half, a little less than half over the last 3 weeks. So that's that really dramatic change you see in those rapid increases and decreases. The other thing we're seeing that's really helping us is test positivity. This is for all test recalls. So when we were at our peak, more than 1 out of every 4 tests was positive. On symptomatic patients, this is up in the 40 to 45% range. We're now down around 10% positivity, and the test for symptomatic is only slightly more than that, 11 or 12 or 13%. So Omicron comes in, wreaks havoc, and then gets down. The other thing that was not as bad in Omicron is hospitalization. So this shows the daily inpatient census for people who have COVID-19. Even though we had double the number of cases in this surge, we never did hit the same level of hospitalization. We had about a 40% reduction at the peak. So we expected that Omicron would have lower hospitalization rate. These numbers got up there because there's just so very many cases. But you can also see now that the cases are dropping. About a week later, we're seeing the dramatic drop in hospitalizations as well. This is further evidence of the less severity. So this orange line is the percent of hospital days that are in the intensive care unit. So when we were in our Delta surge, we were up in that 30 to 40% range of hospital days were in the ICU. Now we're down closer to 20%. So, and you'll see that January and February thus far have about the same average hospitalization, average number of patients hospitalized. However, this one, January is going up and February is coming down. So by the end of the month, this will likely be back lower than that. In terms of school-aged kids, we still have right around 20% plus or minus a little bit. Omicron was a bit more aggressive on kids, but we're still holding some of our schools are still in session. As you know, School District 2 has removed its mask mandate as of about a week and a half ago. This is where you can see the different variants. So early on, we were in the Alpha variant, and then all of a sudden here comes Delta. So all the green is Delta. And we very quickly went from virtually no Delta to 100% Delta. And then then here comes Omicron to town. And over the course of just a couple of weeks, we went from no Omicron to virtually all Omicron. Now we're going to switch to immunity either through natural infection or immunization. If you sort of draw a line along the top of this green, that shows you the rate of increase of people becoming fully immunized. And then if you draw a line across the top of the blue, that's the rate of increase for natural infection. And this is to be expected because there were a lot of cases of natural infection. This is probably understated. Our number of cases are probably understated for a few reasons. One is that Omicron generally has more mild disease, so there are probably a lot of people who were infected and never knew it or never got tested. And also we now have a large supply of home tests, and although people are supposed to report to public health if they test positive, we're pretty confident that not everyone does. So this number of almost 80% of the people who are known to be either fully vaccinated or infected is probably substantially higher than that. So we've had pretty good coverage in the community at this point. Just looking at immunization, so here's the blue line is the number of doses of vaccine given, so we've now given in excess of 200,000 doses in Yellowstone County. That's not all Riverstone Health by any means, but anyone who gets vaccinated in the county, whether it's at a pharmacy or their doctor's office or one of our clinics or whatever. This is where you can really see though that we're not moving the needle much on the number of people who are fully vaccinated. So vaccines really became widely available in late January, early February. So in the course of really just about 3 months, we got from 0 to 50,000. Now we are almost 9 months later, and we have gone from 50,000 to 80,000. So it's just much slower. Here you can see this more directly. The blue lines are the number of doses given each week. That's right on the left-hand scale. The orange line is the number of people who become newly determined to be fully vaccinated. That's on the right-hand scale. So we're only adding a few hundred people each week now to the fully vaccinated number. So that's why you're seeing not much movement in that. When we look at, this is state information, so 54% of eligible Montanans are vaccinated, 54% of eligible Yellowstone County residents are vaccinated. That 54% number statewide has not moved in about a month, and ours just creeped up from 53 to 54. When we look at age cohorts, you can see we have really good coverage up here in the older adults, that's 60 plus. But for kids, we're not really moving much. And actually, when you look here, none of these numbers are fully vaccinated. These percentages, none of them moved from last week or from the 2 weeks ago to last week. So we know that we're just not getting a lot of people who are becoming fully vaccinated. And then this is the last slide. This looks at deaths. We're now at 528 through today. This is our Delta surge, and Delta was much more serious. A lot of people died during the Delta surge. We're still seeing people who pass away. It's fortunately at a much lower rate, but it's we're still at 20 for this month and about 30 for last month, almost 30 last month. So with that, let me stop sharing. Just a couple of things I would say is that we are definitely in better shape now than we were. We're seeing cases drop dramatically. We're seeing hospitalizations drop. We should have pretty good coverage of the community, either people who are fully vaccinated and or recently infected. So we're hopeful that we'll see a little bit of a period of reprieve here. Hopefully there'll be some new dramatic variant that shows up in town. But again, we should have pretty good coverage. We are continuing to see people in the hospital. You'll notice that there's a higher proportion of people in the hospital who are fully vaccinated compared to what we saw previously. But as you've heard a lot about this. There's unvaccinated, partially vaccinated, fully vaccinated, and up to date, which includes the boosters. And the booster does seem to really have a much more profound impact on preventing severe disease and death. But certainly every bit of vaccination we get at people helps. So with that, I will stop, and I'll be happy to answer any questions anyone might have.
Thank you, John. Are there questions for John? Councilmember Gulick?
Dr. Felton, to the degree that you have at the pulse, I guess, of how our healthcare workers are doing, how morale, we've had another surge, just how are people handling things on the front lines?
Yeah, well, first of all, thanks for the promotion, but I'm not a doctor.
Oh, okay.
So I think that we are seeing some improvement in that, in the morale. People got really pretty beat up during particularly the Delta surge. The Omicron surge wasn't so bad because not nearly as many people in the healthcare system. But I do know we've lost a fair number of people from healthcare who just sort of hung up their spurs, if you will, because the difficulty of managing it. We're seeing that really turn around. We certainly have plenty of capacity to care for patients for whether they have COVID or anything else. And I think we are certainly seeing a sense of relief at the calming down in terms of cases and hospitalizations.
Thank you. Councilmember Neese?
Thank you, Mayor. Hey, John, a couple of things. I think you mentioned the vaccinated versus unvaccinated hospital rate. I believe it's around 50% vaccinated versus unvaccinated. So it's kind of hit and miss. Does that seem about right from what you've been seeing?
Yeah, with Omicron, it's been right around 50 to 60% unvaccinated, and the remainder having at least some vaccine. And yeah.
Okay, Mayor, another question. Go ahead. John, recently the requirement for being vaccinated was put into place in the healthcare industry. There were several places around the country where they lost a lot of healthcare workers. Do you know what the amount of healthcare workers that Billings lost with the implementation of that program?
Yeah, it was really quite small. We at Riverstone Health, we had 100% of our employees who were compliant with that requirement, which means either that they were vaccinated or they had an approved medical or religious exemption. I don't know the precise numbers from our two hospitals, but they are quite small.
Thank you.
So we're fortunate in that.
Thank you. Councilmember Boyette?
Thank you, Mayor. John, I realize you don't have a crystal ball, and to me the most important question is, what happens next year, 2 years from now? Is this gonna continue? Do you think it's gonna stop? Will this be like a cold or a flu? You'll have to have shots all the time. Do you have any words of wisdom for us?
Yeah, you've all learned by now that my crystal ball can be a little bit hazy. But here's what I think. This thing is not going to go away. We're going to continue to have cases. The real, we talk a lot about, when do we move from a pandemic to an endemic situation? And so I would compare this to the way we manage influenza. And I've told you many times, COVID and influenza are different. But in terms of sort of how you manage them, and influenza comes every year. We know about when it's going to start. We know roughly how many cases we should expect. We know when it's going to peak out and when it's going to go down. When you have that kind of predictability, that's really what being endemic is all about. So I think that's where we're headed. We've got a large proportion of the population that has some immunity coverage either through natural infection or vaccination or both. And so I feel like we're headed that direction. Now, I think the other part that comes with accepting an endemic disease is you don't have that sort of dramatic response. You're certainly cautious. We warn people about influenza every year. We encourage them to get vaccinated. We put out word when a lot of disease is circulating and people are at higher risk. That's where I think we need to get with COVID. It's going to come back. We're going to have surges. As more and more of the population has a degree of immunity, then the variants will also slow down because they just don't have a susceptible population to get to. So I think we're headed that way. I don't know when someone farther up the food chain than me says, okay, now it's endemic, it's no longer pandemic, but that's definitely where I believe we're headed.
Thank you. Any other questions for John? John, I don't see any other questions. So again, we appreciate your service and those of your staff. Please communicate that to them. And no offense, but I hope we never see you again, but I have a feeling we will.
No offense taken. Thank you all.
All righty. Thank you. Okay, our first item on our written agenda is the Vista Economic Development Rock 31 tax abatement update. Steve Varvaskow, what national? That's Norwegian, isn't it?
Yeah, it's Norwegian, so I can't speak the native tongue of Ukraine. But I can't say interesting story. No, I can't tell a story because we're limited in time. So I'll tell you the story offline about an economic developer from Ukraine. Very skilled, speaks 5 languages. I'm working with International Economic Development Council. He's trying to find other opportunities, obviously, outside of his country.
We'd love to have them. You know, and speaking of time, though, I'll just comment for the rest of the council. There's 3 elements of Steve's presentation. Or his team. We'll take some questions after each one of those sections. We'll try to keep the questions about 5 minutes. Steve thinks each section might be about 10 minutes. So we're hoping to be done in about 45 minutes for this piece. And then hopefully that'll still leave us about an hour for a Substance Abuse Connect. And then we'll be done with those 2 items before we take a break. That's our goal for tonight, to get through those 2 items. So, Steve, go ahead.
Thank you, Mayor, Council. I appreciate it. Kevin, I have a PowerPoint presentation that I plugged into this laptop on the podium. If you want to get that. While Kevin's doing that, I did put a packet at each of your places. And I just, for note, in that packet is a list of our current board of directors, both on the EDA and the EDC. It also highlights the ex officio. And you'll see 2 open positions, one for the city of Billings and one for the city of Laurel. And I know you're discussing that now, and happy to help with any questions you have related to that. But I wanted to note that packet and then the list of current board members in case you're wondering who else serves on our board of directors. Can I have a clicker, or?
I don't think we have one.
We don't have a clicker? Okay. I'll just say click, and then we'll we're going to cover 3 quick things. One, an overview of our organization. And as I share that with you, one thing I want you to be thinking about is this partnership. And I really want to stress that. We have a partnership, obviously, with Yellowstone County, but we have a very important partnership with the city of Billings proper. And then, obviously, we work to serve the citizens of the city of Billings. And so just be thinking in the context of partnership that way. Click.
That's it. We're done.
That was one click? Okay. There we go. Awesome. Oh, awesome. Okay, thank you, Kevin. I really appreciate your help with that. So important to start and describe our public-private partnership, and we really function that way. The EDA was created first. The Economic Development Authority was created by Yellowstone County Commissioners in I have the power? Okay, awesome. In 1989, and the commissioners appoint the 11 board members to serve on the EDA as the governance for that work. And when the EDA was created, it was charged with the responsibility of leading economic development efforts in Yellowstone County. The commissioners also appoint ex officio board members, and so that's where the city comes in. That EDA table is to be beyond the appointments, to be an inclusive table. We have the chamber that's ex officio, the school district is a member, an ex officio on that board, and then we have the city of Billings, the Laurel, and then one county commissioner comes on the EDA board as in an ex officio capacity. And so that's a pretty good table in terms of setting direction for economic development. In 2002, the EDA board decided, hey, we need stronger private sector connection and partnership, and so they created a not-for-profit corporation made up of member investor companies, and right now we have about 137 of the top companies in our community that make additional financial commitment to the work of Big Sky Economic Development. I'll show you what that financial commitment looks like. But they then elect their board members. So the EDC side of the house has 22 board members, and they're elected from among those member investor companies. So 2 boards coming together under the umbrella of Big Sky Economic Development function as one large board, and so we meet on the first or the second Thursday of each month at 7 o'clock in the morning. We've been using this space here lately because it gives us a little bit more elbow room. and they set policy and strategy, set budget priorities, and general direction for the work of economic development. There are some work that we do as an organization that's unique to one board or the other, and when those things happen, we just have separate board votes on that. But they're all always meeting together as one board, and that meeting is open to the public. We take public comment at the beginning and the end, just like you function as well. Because of our quasi-public nexus on the EDA side, we figured the whole thing's an open process. Our mission, as you can read there, is broken into 3 pillars, and I want to describe those for you as well. And so if you ever have a chance, somebody says, what do they do at Big Sky Economic Development? You don't have to memorize this mission. I just ask you to think about these 3 pillars. Everything that we should do somehow fits in one of those pillars as an organization. And the first pillar is our business growth services, and you can see those icons across the bottom. And Pam, I'll use more than just those letters, and I'll describe what we do that way. This is all intended to help our existing business community or new entrepreneurs or new business growth, focusing a lot of time and resources in helping our existing business grow as a foundation to our economic growth. And we do that with several programs. We have a Big Sky Finance program that does lending to small business, actually throughout the state of Montana, through what's called our 504 loan program. We also have a Yellowstone County specific revolving loan fund program that has about $1.8 million in it for additional lending just in Yellowstone County. And so we use that lending tool sometimes in partnership with local banks or statewide banks, and sometimes we just make direct loans ourselves. And that's helping businesses grow, make new private investment, create jobs in our community. Billings Works is our initiative on workforce development. It's something that we had put together. It's a very large roundtable of all the key players in workforce, both private sector and educators and others that want to help come together on joint strategies and efforts around moving workforce development forward so we can meet talent needs in their community. So when you hear Billings Works, just know that that's not just us. That is a large table, a lot of key players coming together to strategize together as an organization, including you guys. Montana PTAC. So first one, PTAC is Procurement and Technical Assistance Center. We counsel with companies who want to be in a position to do business with the federal or state government under contracting. So if you want to sell something to the Forest Service, a product or a service, whatever it might be, we help you be competitive in that process, get you registered through those unique processes that the state and federal government has, and we'll help thousands of businesses throughout the state of Montana, have contracts with state and local and federal government to do business and as an add-on to their business portfolio. And frankly, we'll do tens of millions of dollars a year in contracts are let in the state. In fact, if you looked at it statewide, it'd be excess of hundreds of millions of dollars are being spent in Montana. We're trying to get local businesses the opportunity to have that money spent with them through our PTAC program. And then our Small Business Development Center, SBDC, that's what that stands for, and they do free consultation, training work for local businesses, helping them either grow or start a new business. And we do that actually on a multi-county level, with Yellowstone County being the hub for that program. VBOC is Veterans Business Outreach Center. That's a program that is 100% funded by the federal SBA, and the intent of that program is to connect with veterans and their spouses or men and women leaving military service who are interested in running and starting their own business and being an entrepreneur. So very unique services for those who are exiting military service, encouraging them to look at being an entrepreneur and being a business owner. And then our Rock 31 initiative, I'll talk to you a little bit more about that in a second. Our second pillar is community development. we're all about helping city and county, the urban renewal districts, other partners in the community lay the foundation for our economic success. So we do a lot of grant writing. We help do planning. We do a lot of partnership with your tax income and finance districts on various projects and planning that they have involved. We do the EDA's Brownfields Assessment Program. It's all about helping create an infrastructure that supports economic growth. We've been writing grants. We started writing grants in 1989 when the EDA was first created, and we've been writing grants on behalf of the county and the community since that time. And then our last pillar is new business recruitment. Sometimes this is the one that gets the headline and you learn about it, and you know, it's the one that everybody likes to go to the groundbreaking or whatever it might be. We spent a lot of time being the point person for businesses looking to expand and grow in our community. It takes a lot of road miles. Allison is our director of new business recruitment. She's out of the office more than she's in the office in many respects because she's out interfacing with CEOs and company execs. We work very closely with the state Department of Commerce as they're initiating more and more new business recruitment. Our job is to help them, get them connected to resources. And you saw that play out when we came to you to talk about Coca-Cola's manufacturing plant. That was part of the work that we did at Big Sky. If you wonder where our money comes from, this slide is a year old, but it gives you a general sense of our revenue. About 40%, if you look at it in the whole between both organizations, about 40% comes from a mill levy on all the property in Yellowstone County. So when you get home tonight, go pull out your home property tax statement, and on the bottom you'll see Big Sky EDA, and you'll see about 3 mills of assessment. Average homeowner in Billings pays $15 or $16 a year to the work of economic development in the community, and then collectively, obviously, that adds up and provides us about 40% of the revenue to do our work as an organization under that EDA structure. We then do our loans, and we generate revenue through our lending, we generate revenue through our member investors, and then we generate program revenue specific to some of the individual programs that we're doing. So we have contracts in place with the state or the Fed to deliver a program, and we get reimbursed for all or a portion of that program. So that's part of our revenue portfolio. I want to point this out quickly, and then I'll move on. Business growth services, this slide's a little dated, but we put about 75% of all of our resources into that first pillar, helping our existing business community grow. So if you ever hear, man, they're putting all their time and energy in recruitment, you can look at the numbers. Allison will tell you, she works pretty hard and doesn't have a lot to bring to the table sometimes because we've prioritized how we're going to invest our resources. Not that recruitment's not important, because it is for the health of our economy, but we really feel the starting place is helping our existing businesses grow. I won't go through these because if you came to the December 15th when we did our stakeholder our strategy partners, you heard me talk about our aspirations, what we've envisioned for the future of the community. So these are those aspirational statements. The next question that we always answer is, what do we have to do to get there? What do we have to do to be the most attractive community our size for talent? And so that's where we develop, in addition to our core programs, we develop a set of strategic priorities as an organization. And these are the 5 areas of strategic priority. You have them in your written packet. I've reviewed them with you before. Under each one of these areas, then, we develop a set of objectives. And those objectives outline our daily work. What are we going to focus our time and energy and resources behind to try and accomplish those strategic priorities? And I'll skip through those real quick as well. Mayor, how am I doing on time?
You're about 12 minutes into your first section.
Okay, I'll move quickly. I want to leave you with just 3 things I want you to think about as we talk about what we can partner on together, and then I'm going to talk about Rock 31, and then we'll end with tax abatement. So this picture is a picture of the schematic design of Rocky Vista University, or the Montana College of Osteopathic Medicine. which is coming out of the ground in a big way, 137,000 square feet. The building's really important, and it'll deliver world-class education to future doctors. That's really important. But the picture below is one I want you to be thinking about with me, and that is the young men and women who aspire to be practicing physicians, in many cases with a focus on primary care, rural medicine. They're going to be coming to our community June of next year. In fact, Rocky Vista will start accepting applications. The proposal is by August of this year, they'll actually be reviewing applicants. And many of them will fly to our community to see what we're all about and interview in that process, assuming we can, according to John Felton, it looks like we might be safe to have that in-person interview process. I want to make sure we're in a strong position to give these students, these aspiring physicians, the best welcome possible that we can as a community, help them be successful in their medical education, and then hopefully, frankly, convince them we're absolutely the community they need to practice medicine in. So we're putting together a little task force around that topic, and something that we would absolutely want to partner on, and very important. I think you've probably seen this slide. I'll just say quickly, people are moving to our community. That's pretty obvious. With some of the pressures we're experiencing now, for everyone that moves out, 3.9 move in. We are a place where people are coming. And so what it means is we want to pay attention to how we're growing as a community, continue to invest in our quality of place. We recently did a survey of our board of directors and all of our stakeholders, and they have identified that crime, homelessness, substance abuse is still a very important issue for the community, as you know, as you have dealt with as a council. They also said that talent and workforce was important. So we want to keep those as we do economic development work. Not that we can solve all those problems, but that needs to be in our calculus as we defined our strategic priorities. And absolutely would want to partner with you on both of those topics. Finding funding for parks and trails. I know that you're working on that. I know there's conversations about that long term, really important foundationally for economic growth. So just something to seize that opportunity and work to resolve it. Housing, I've had conversations about that, and thank you again, Council, for your major decision on supporting the development downtown. And then the last one I would leave with you would be just our downtown, the development of our downtown in the context of our medical corridor investment. And I've shared that with you at your last meeting. That's a really important opportunity for us to seize. I'm going to move quickly to Rock 31. You're wondering what we're doing behind City Council, your City Council building, chambers. We're renovating a 1918 building from bottom to top, and next time I ask you about doing that, maybe give me a little reality check. That's a big undertaking. But we're creating a center for entrepreneurship development. We feel it's very important that we strengthen the entrepreneur ecosystem in our community, that we provide the resources for entrepreneurs to connect with each other, connect with mentors, connect with funding tools, connect with our resources, and do it in a way that it kind of raises the bar and engages the entire community in supporting entrepreneurship. We also think it's important for us to be purposeful about diversifying and growing our community from the inside out. And so our whole focus on growing new business and all of our resources, we're taking that to a whole other level with this building. And you're going to see a co-working space dedicated to entrepreneurships. We'll have private offices, dedicated desks, shared workspace, large training room and conference room. That'll be an asset for our entrepreneurs and an asset for the community in the heart of our downtown. And we're excited to share that with the community. We're also going to include a barista there under what we call our barista consumer products incubator. We'll have an active live incubator for folks who aspire to have their own coffee shop, prepare their own coffee brands, prepare their own consumer products. You'll be seeing that experience played out with a barista that'll be featured on the first floor of the Rock 31 building in downtown. We're in the middle of a capital campaign to support this effort. We call it Let's Rock. We have about 50 active contributors in addition to the funds that we were able to bring together, a federal EDA, the generosity of Chris Nelson and Mike in terms of helping us get into that building at a very affordable cost. The federal EDA dollars brought in some of our Opportunity Fund dollars, and then now we're at 50 plus additional contributors who really believe in the mission and what we're trying to do with entrepreneurs. At some point, we'd love to talk to council about being a contributor, even in a small way, to that entrepreneur experience in the heart of our downtown. I am going to stop there, Mayor, and take questions on these two sections, and then we can move to the tax abatement discussion.
Great, thank you, Steve. So, question about what you've heard, the overall structure and goals and mission and challenges of Big Sky Economic Development and the Rock 31 program. Are there questions for Steve on either of those general areas? Wow, Steve, you did such a good job. You left everybody questionless.
I'm not quite sure if that's it, but if I need to fill in the blanks on anything, I absolutely will. Happy to do that, and we very much appreciate the city's partnership.
It looks like we do have a question. Councilor Prington.
Well, I don't want you to go away without a question, Steve. So with the survey and those, I listed 5 topics, the crime, homelessness, substance abuse, and then the other 5. So in that survey, was there any room for input into how those can be solved?
The way we positioned our survey, we got about 200 plus responses back. We asked them to express to us their top concern, and we gave them, they could write in a concern or they could pick from 10. Some of you may have actually taken our survey. And so we just wanted to gauge how they prioritize some of the issues that we're seeing. And the crime and homelessness came out 1, and talent attraction came out 2, and I should be happy to share the results of that. We didn't ask them specifically how to address that, but in the next question in our survey that I didn't share, we listed a set of tactics. Here are 25 things that we could do that we think might be helpful. Didn't necessarily talk about a funding stream or that sort of thing, but if we're going to attack these issues, how would you rank these 25 initiatives or strategic priorities in getting us moving the goalposts on that? So we'll absolutely share that information with you. We did not ask the question, are you willing to pay a higher mill levy? Willing to pay more tax to accomplish this? That's certainly always a part of the discussion that you need to have when you look at investing in infrastructure or addressing the issues that you have to.
Thank you.
Stephen, I guess I've got a question for you now that you're deep into the remodel of the Montana Bank building where you are. We're looking forward to that being an active part of the critical hub of downtown. What can we expect, especially from the exterior? You've removed the landscaping planters, so will we see some improvements to the streetscape, even if those have been removed?
So we'll be resurfacing the outside of the building, restoring that outside to its more natural state. Remove the planters in part for aesthetics and room on the walkways, but also they were irrigated, and so there was some leakage into the basement. We just wanted to remove that problem. So you'll see that whole outside restored. We're actually working now at the federal level to have that building listed on the National Register of Historic Places. So preserving that outside was really important. We don't presently have budget to change the landscaping. Love to talk to Parks about what they want to do with that landscaping, or Katie in downtown. Right now, that is not a part of our scope. But you will see the whole outside of that building restored to its original state.
Okay, thank you. Councilmember Gulick?
How is the schedule looking? I'm sure it's a chaotic construction environment, and existing buildings sometimes bring surprises. So maybe have evolved over time. Just what's it looking like now?
And I think that's a question. Always know the answer to the question before you ask it, and especially in your business. We're over budget, a little closer on schedule. We had hoped to be in there in April, but as we started to revise the scope, we knew it would be about a June timeframe. So look to sometime in June for us to be in that building, likely to have a soft opening then for entrepreneurs first part of July. We're doing value engineering on an ongoing basis, but we're also at this, and we've saved money because of that, but we're also discovering change orders on the same level of frequency. And so it's costing us more and taking a little bit more time. We want to make sure we do it right and do it well. But it's an expensive undertaking, and you discover things in a building that's over 100 years old that you weren't anticipating.
Thank you. Any other questions? Don't see any. Thank you, Steve.
Thank you.
Steve 1 to Steve 2.
Thank you, Mayor Cole, members of council. I'm Steve Simonson, and I'm going to run through our tax abatement program with you this evening. In 2005, the city adopted code to allow for the 10 and 5-year programs. And the 5-year program has a floor of $500,000 of improvements. And after that 5-year period, those taxes go up to the full property tax value. Leased buildings are typically not eligible for the abatement. So that's what the 5-year schedule looks like. It's 100% abatement for those first 5 years. 10-year program's a little bit different for the new and expanding industry. There's actually a 75% reduction in those first 5 years, and then it gradually goes up over the next 5-year period, and I'll show you that in the next slide. There are some additional caveats that 50% of the revenue has to be generated from outside the state, and we're always looking at the quality of jobs being created. These are the side-by-side comparisons of the 5-year. The 75% abatement is known in statute as 25% of the new taxable, and then the 50-50 programs on the right side. Lots of information on this slide, but I want to point out a couple of things. We've had up to 25 businesses utilize this program over the course of the last 16 years. We currently have 10 in the program. There's 2 abatements going on at the Phillips refinery right now, so actually 11 total abatements are active. The job creation I would bring to your attention in the lower right-hand corner of the slide. We've had 95 jobs grow in the last year, and so I think that's really impressive that both the city and the county are willing to make that investment in our diversification strategy for growing new business and existing businesses. So I wanted to pull the 2 refineries out on the bottom just to kind of show you what most of the abatement is going to the refineries in the county, and Yellowstone County accounts for 2/3 of all the manufacturing in the entire state of Montana. Most of that's coming out of the refineries. So some good quality job creation going on. There was also some environmental improvements that were done at the Phillips refinery that are in those tax abatement programs. And of that 154,000 that's in the lower right-hand corner of that slide, the investment that the city of Billings has right now is about $31,000 in property tax. So 95 jobs, about $31,000 in property tax set aside. I wanted to share an example of how the program works here. This was an abatement that expired in 2019, but I think it's a really good example to share with council members. If you go to the far right-hand slide, corner of the slide, there's an increase over the beginning tax value to the current tax value, and the increase to the program was over $32,000. So that's how we're growing the tax base in the economy, and the jobs are coming with it. And I think that's a really important factor for council to consider tonight as we look at the update. There is a little bit of lag period. You might have noticed in the first slide, this was a 2020 presentation. It takes a while for mill to be set and for income surveys to come in. So we're a little bit of a lag behind report, but this is the latest numbers that we have available. And with that, I'll take any questions you might have on tax abatement.
Questions for Steve? Councilmember Owen, Councilmember Joy?
Steve, how do you know that the jobs created are directly tied to the tax abatement?
Yeah, so Councilmember Owen, we have to do an income survey back to the businesses, so there's an annual reporting requirement as part of the tax abatement program. So they certify that a certain number of those jobs have been created from the prior year.
Can I follow up? Sorry, that doesn't quite answer my question. That just tells me they created new jobs. How do you know it's the tax abatement that caused the job creation?
Yeah, we don't.
Okay.
It can be assumed that the tax break helped the business become more profitable. Patrick Klugman, who's handling our member investment program, gave us an example of a business that was granted prior tax abatement and told him through the member investment process that they may not have survived without that investment up front. And now they're creating an additional 20 jobs in our community. So we know the program works.
Thank you. Councilmember Joy?
Thank you. I have a question on the slide that you had just before the last one, the highlighting the business. And I want to, maybe I'm missing something in terms of taxable value versus market value. So you have highlighted, I'm sorry, it's just one, it's called highlight, and you have motor power equipment. You've gone too far. Yeah, right there. Sorry. Can you explain the difference in the slide? You're talking about market value. How does that coincide with a taxable value? Or in a sense, our return on the investment in terms of tax base? Or can you explain that just a little bit more thoroughly? I think I missed something in there.
Councilmember Joy, I'm not sure that I fully understand the question. Let me take a shot at that. And Steve, if you've got some additional thoughts, please chime in.
Walk through kind of each of those columns.
Sure. So, Councilmember Joy, there was an initial investment, capital investment, as we start on the left-hand side of the slide and progress this way. An additional $2.5 million was put into a project that had a beginning market value of 1.9. That as property has increased in value, then that ending market value has increased as well. So there's a differential of $3.5 million of actual increase in the market value, and the taxes on the right-hand side are proportionate to that growth that we've seen with that initial investment. Does that help?
Thank you.
Councilmember Nice?
Thank you, Mayor. I actually had a question about this slide too, because when you look at the increase in taxes of $32,764, and that's a 10-year period, correct? Is that per year number, or is that the total for 10 years?
Yes, I believe that's correct, Councilmember.
Per year. And so if you look at that and over a 10-year period, it's 7% growth. I believe I calculated that out correctly. So how does that compare to property values increasing over 10 years for this type of property? Is it matching? Is all of our investment abating all these taxes over the time really paying off by giving a larger or faster increase of what normally would happen if they didn't invest in it?
Councilmember Neese, if I understand your question correctly, is the abatement growing the market value of the property at the same rate that property taxes would be? That's probably a question for Department of Revenue more than me on that. Steve, do you have anything to add to that?
I'm making some notes
Okay.
on questions.
And I would be happy to answer that question and get back to you on that.
I think that would show a better measurement of how successful the program is. We can compare what the other properties like that are to what we actually invested in to help them and see where we're growing.
Point well taken. Let me get back to you on that.
Further questions for Steve? Chris?
So Mayor and Council, mine's not a question, but Steve, actually goes back to both Steves, but the partnership with Big Sky Economic Development is an important one. I mean, of the 3 communities I've gotten to serve in Montana, we by far have the most robust economic development effort that goes on, and it's, if they were not doing it, it would be looked to the city to be much more in this game directly. So they're a critical partner with us. As Steve also mentioned, it's not nearly as sexy or interesting, the job growth from current businesses, but at least in the old days when I started in this business in economic development, 80% plus of new jobs are from existing businesses. Only about 20% came from the outside. People are always interested in that outside thing that's landed, but as was talked about, the refineries, the hospitals, you all hear it. It's job growth from within that the lion's share of jobs come from. So having that relationship actively with those businesses is very important to our local economy. And so I just wanted to, compliment them and their work. I found them to be extraordinary partners as we work to build a thriving economy in Billings. If they weren't doing it, I would be asking you, and in fact I did that in the past, added an economic development director position to the city where we did not have a partner like Big Sky Economic Development. So I think they are very important to our ultimate economic success as a partner. So thank you.
Thank you, Councilor Gila.
Yes, thank you, Mayor. Just as a rookie council member, just curious in terms of the tax abatements, how does it come to the council? What's the council role, I guess, in abatements?
Either way, yes, they have to be approved by the council. We do not have the authority administratively or through Big Sky Economic Development. They're approved at the county and city board levels.
And school district as well, how does that work?
The requirement is the school district, other taxing jurisdictions are notified of the process and can participate, they're notified in writing of the process and can participate in hearings related to the tax abatement. The approvals rest with the county and the city.
Councilor Purington?
So just a question to Chris, the comment that you made. So do other communities, other municipalities within Montana have a type of EDA?
In the Flathead, we had a privately funded, I don't remember if there was any. Steve, you help us with what the other entities are around the state.
Yeah, Chris, I think there's only 4 or 5 entities that are using this program in any way, shape, or form around the state, and we're by far leading the pack on that. Cascade County, Missoula, Gallatin, and Flathead counties.
Great, thank you.
Other questions for Steve? Councilmember Rupsis?
Thanks, Steve. I guess you had a slide where you showed the different tax abatements over the last 10 years or so. I was surprised that there are so few of them. If this is such a good program, why, and it builds jobs and it's good for the companies, why aren't we seeing more of these?
Councilmember, that's a really great question. We need you guys out there in promoting the program as well as we do. So when someone's coming to our community or growth from within, we're always talking about this with our Business Recruitment and Retention Program and partners. And Tom, part of it might just be hitting that floor of that $500,000 initial investment. That's obviously getting easier now with inflation and things, but that's been perhaps one of the sticking points in the past.
Thank you. Any other questions, Councilmember Neese?
Thank you, Mayor. Steve, you may have covered this in some of the screen, but I just want to be clear. So as people are listening, as far as tax abatement, you know, if I understand correctly, we don't abate everything, even on the 0%. Can you kind of give an example of someone who, what the property tax is, how much we abate, you know, and when, so that people know we're not just giving all the taxes away?
Sure. Councilmember Neese, I think if we go back to that power slide, maybe that'll help a little bit with that. It's only on the new investment. It's not on the existing tax base on that. So it's just the incremental growth on the new investment.
Similar to like a tax incentive district where it's incremental, we're only abating incremental amount, not any existing taxes that are being there. So school board doesn't get hit when we do abatement immediately. It's just going to be the increase is what they don't get.
Yes, that's correct.
Thank you.
And Steve, since you got the slide up, and back to Councilmember Neese's original question of what part of that $32,000 is attributable to the tax abatement, I guess my answer to that would be, it would be whatever percentage the new capital investment is relative to the old original starting value, which in this case, I just did some quick math, it's 57% of the value comes from that new investment of $22.5 million roughly compared to the starting value. So roughly 57% of $32,000 and change is about $18,000 and change. But that seems like the way to look at it is that's the whole idea. We're just trying to promote new investment and increase of the tax rate. Further questions for Steve 1 or Steve 2? Or anything else?
Just some.
I don't see it, so back to Steve 1.
I'm feeling like I'm in a Dr. Seuss. I got a text message from Allison, and people pay attention to everything that I say. And also, what I did not say, she wanted me to invite you to the groundbreaking for the Coca-Cola manufacturing project. It is on March 31st. At 3:30 in the afternoon. So we'll absolutely follow up with more detail, but she wanted to make sure that that was on your radar. We have a really strong partnership in that project, and that opens up opportunity for much more development. So we absolutely want the city to be a part of that. So I wanted to give that information. Chris, thank you for your comments in terms of the partnership. I really appreciate it. I frankly think the most important thing we can do going forward is make sure we're comparing notes on what our strategies are so we understand how they dovetail, who's doing what. And so as you do your planning, our board is going to be doing our planning on March 10th. At some point coming together and understanding what are we trying to accomplish together. That is a really important next step in the partnership that we have.
Thank you. Steve, are you still doing your tours of your new building on Thursdays at 1:30?
Yes, absolutely. Would love to. We've got a tour coming up. Patrick tells me we have a good number of folks coming this Thursday for a tour. But you would absolutely be welcome. Just either shoot me an email or shoot Patrick.
Great. Thank you very much. Okay, this is an opportunity there's an opportunity for public comment on item number 1. So if anybody is with us online or in the audience who would like to comment on anything you've heard with this item, please come to the podium and speak into the mic. Is there anybody who would like to offer public comment? No one is present here who's coming forward. Kevin, is there any sign of anybody online? Nope. Doesn't look like it. So we'll close the public comment period on item number 1 and move on to item number 2. Substance Abuse Connect, Rimrock Homelessness Outreach Team. Chris, do you want to give us a little bit of intro, and all of our presenters can find their way toward the podium?
Happy to do that. And Steve, again, my apology. I made the assumption that Arviska was an Eastern European, but sure enough, it's I'm clueless. We're talking Norwegian. Scandinavian, Norwegian, full on. So, anyways, so moving on to Substance Abuse Connect, Kristen Lundgren's going to kick things off. We actually want to take a little bit of an opposite approach to what we just did a minute ago, where we gave some presentation. The mayor and I went over it this morning. We thought with 5 topics, might be wise to get the holistic piece in and then go and do Q&A after that. So Kristen's up first. And sorry that's not very adjustable, is it? Not adjustable at all.
It's more expensive.
No, they were more expensive.
Should I just talk loud? Can you hear me?
I think we need you to speak into the microphone, probably for Channel 7 to get it.
Okay.
I don't know if this will
Look
work.
at that.
I don't think I can do this. I can't with my hands. We're just gonna try
You
our
just
best.
point it down.
I tried. I'm gonna.
Look at there. Thanks, Jason.
Well. Goal number 1, I'm gonna grow 2 feet this year. Up. We have a PowerPoint, I think. Is it there? I'm Kristen Lundgren. I'm the Executive Director of Substance Abuse Connect, and I just want to say thank you to all of you for the opportunity to be back here in front of you. To the new council members, congratulations, and thrilled, to be able to maybe share some of this information with some of you for the first time. We are here to do more of an update, and we'll be given a high-level overview of quite a bit of our work. So if there's any detail that you're lacking, we can fill in the blanks at any time. So we'll do that.
Getting it set up
Getting
here.
it? All right.
Just one.
We do have a crowd with us here from our coalition, so, well, there we go. In case, again, for those of you that may be completely new to our project, we are a very unique public-private partnership. We started in 2018 with a lot of questions, the stuff that Steve Arbesco was just talking about the crisis in our community, the crisis of increasing crime, addiction, homelessness, the intersection of all of that, and just the belief that we could do better. And we have started with 18 people, 0 money, and a 1-page plan. And we're very committed to moving forward, and we are here today with around 200 and some members working hard. First it's the mic, and then am I doing the right? Yeah. That's all right.
We'll try to advance manually if we can. If the clicker's not working, once we determine if it's the clicker or the
Clicky.
clicky, yes. Kevin
clicker or the
Iflin is the clicky.
Click right here.
There we go. All right, so back to, we do believe there are solutions. And our work is organized largely into 2 task forces, prevention and treatment and diversion. And we are not going to be doing any kind of a deep dive into our prevention work tonight. We're going to focus on the treatment and diversion task force just because of the nexus with public safety and some of the critical issues at hand today. But I want to acknowledge our prevention task force, and I want to say it's half our work. And we truly believe that investing there is going to be critical to solving our problems in treatment and diversion. And if we don't, we won't succeed. So I want to recognize Heather Fink. She is a co-chair of our prevention task force. She's the director of health provision, public health at Riverstone Health. And her co-chair is Karen Sylvester from the Mental Health Center. And I don't think Karen's here tonight, but I just want to recognize the leadership of those outstanding women and the multiple people in the community who help with that work, who they're not here tonight because we mainly brought our crisis leaders here tonight. So this is our agenda for you. I am going to do an overview of the handout that was provided to you ahead of time. And again, we have a hard copy here tonight if you need it. Going going to hand it over to our partners at the DBA MAP program and their HOT team for a success story. Jason Banfield, the Assistant Fire Chief for EMS, to talk about our work in mobile crisis response, and wrap up with Chief Valdez and Chief St. John in terms of the nexus of our work with their worlds. So this handout, oops, I think we're going to go here first. There are just a couple things that I want to point out to you on the first page. Starting at the bottom, our members, and I am going to recognize those folks who are here today. So 911 dispatch is part of our team. I don't think Derek is here, but 988 and 211 provider, they're in Great Falls. They're part of our team. Alternatives Inc., Jan Beggar is here. Billings Fire, Billings Police, and I do want to recognize Officer Manser because he's in the back, and he's been assigned from the police department to participate in all of our meetings, and he does an outstanding job being a liaison, between law enforcement and the nonprofit sector. So just want to recognize him. The Community Crisis Center Director Marcy Neary is here. Downtown Billings, we've got Katie Easton, Cody Christensen, and the HOT team, their team here. Montana Rescue Mission, I think I saw in the back, Matt Lundgren. Region 4, Probation and Parole, as you know, Probation and Parole, we've got a lot of probation and parolees. And that's been a focus of ours from the beginning, is how do we do a better job with preventing the escalation of individuals who are in probation and parole. So they're an important part of our coalition. Rimrock, I see Lynette's here from Rimrock, the director of Rimrock. We partner very strongly with the Continuum of Care. Those are the folks who are working on housing, because housing is a critical part of the solution. We have a lot of overlap of players and issues. So the Continuum of Care is part of our crisis leader team. And Dean Wells is here. He provides backbone services to the Continuum of Care, and many of our members here are crossover partners. Yellowstone County Sheriff's Office is also a big part of our team, and we are bringing on additional members this spring. So that's who we are. The next thing, you just want to point out the definitions, that we know there are a million definitions of crisis. So when I say I had a crisis today, it could be, that this microphone thing. We know that it's a crisis when you don't have a roof over your head. It's a crisis when you're in domestic violence. It's a crisis when you can't find childcare and you need to work. So there are many types of crisis in our community. We worked hard on this definition sheet so that when we are working together, have a common lexicon, just a common a way of understanding. When we say crisis in this context, we are talking about individuals who are in mental health or substance abuse crisis, who are in need of stabilization services. And that's what we're talking about. So just to get us on the same page. And then finally, I just want to call attention to the diagram up at the top. This is the evidence-based continuum that we are working on building in our community, so that when you have an individual who's in crisis on the left, that we are able to provide the quickest access to the most appropriate, lowest cost care right now. And if you think about the emergency system, if you have fire, you know to call 911, and there's a system that responds to you immediately, and nobody asks you, do you have insurance? I'm not going to come out to your fire unless you have insurance, right? Nobody questions that you need to go put out the fire and then deal with the, so the nation is heading in this direction of we need this kind of response for mental health and substance use disorder as well. This is the framework, and we are missing a couple pieces. So where it says new up there, we do not have the crisis line, that it's a necessary part of this continuum. We don't have mobile crisis response, but those are two things that we're working on getting up and running. And then crisis stabilization, we do have our 24-hour crisis stabilization facility at the crisis center, so critical. Rimrock has 72-hour crisis beds. We're figuring out how we utilize those better, and we can do more in that arena. And then the last thing is post-crisis wraparound. So when you come out of crisis care, when you spent your 24 hours in crisis care and you come out into the community, how do you prevent that crisis from recurring? You prevent that by having excellent, post-crisis wraparound care. So we recognize, and we've done some deep dives. We're doing more deep dives into where the linkages are broken and what we can do to fix it. So being together is really important. We call this an ecosystem approach. Everybody that's on this team has made a commitment to ecosystem thinking. And even when that comes to budgeting, all these pieces need funding. If we put all our eggs into one basket, let's just take, for example, mobile crisis, which we are going to need some funding for, and we increase traffic to the crisis center by 30%. We haven't thought about increasing capacity at the crisis center, then what? And then I'm going to skip to our next slide. That line across, just when people when you re-enter out of the crisis system, again, if we don't have great wraparound post-crisis services, they are just going to re-enter the system. So we've got to think as an ecosystem about how all of this works. And we believe there is enough funding to do it all. And that's part of getting us all at one table and figuring out how wisely to spend our money, talking to each other and figuring that out. And this group has done an amazing job of doing that. I want to point out that when we do a good job on the bottom half, about 85% of these folk can be stabilized in the community and don't re-enter the system. Also want to point out that it costs more top to bottom, it cost decreases as you go down. ER is most expensive. Having a crisis stabilization facility is cheaper, and then it's cheaper to provide the prevention and the wraparound services. What we want to make sure as we're working together as a team is that we don't have a whole bunch of individuals going to the emergency room who could be served in a crisis facility. We don't want to have a whole bunch of people going to the crisis facility who can be served, I'm calling it below the line. And we want it to be crystal clear for our law enforcement partners when they're encountering somebody, whether it's mobile crisis or, just out, that it's clear where the police drop-off points are and how we determine that. So that's just a really quick overview of what we're doing in the work of crisis. And I'm going to talk just for a minute to you, I'm not looking well here, about 988 before I turn it over to our other speakers. Just 30,000 foot level, guys. And again, any detail you want, we can provide it. Of course, this is where it fits in our continuum, the crisis line. This is the status now and what we expect in August. So currently, if you're an individual in crisis right now, you can call 911 or you can call the Suicide Lifeline. Those are your two options in our community. If you're a person for whom crisis is expected, I didn't talk about that on the last handout, but we have two populations we're focused on. One is crisis now, and one is individuals that we definitely can expect to be in crisis now if they don't get some kind of support. So those two populations. So that crisis expected population, the line that they can call is 211. And several of you that are at this table have helped us with 211, looking at Mayor Cole and others to get that functional in our community. 211, the Suicide Lifeline, live in the same organization. Their staff are cross-trained, share a database, etc. Come August, that Suicide Lifeline is converting to a true crisis line, 988, across the whole state of Montana. And that 3-digit number will be publicized for mental health crisis and substance abuse crisis. So it won't be only for people who are suicidal. And I think that's really important because we expect volume to increase to the 988 line. And our community part, there's a lot that our community needs to do to be ready for 988 so that when people call them in crisis, the 988 operators know where to send them. And we are working on the relationship with 911. So, in an ideal world, and we've studied crisis call models in other places, in an ideal world, 911 can divert calls that really aren't 911, but could be better handled at 988 down to 988. And so we're figuring that out. That's the 30,000 foot level there. And I am going to now turn it over to our partners with the Downtown Billings Alliance, Katie Easton and her crew, to talk about Project Hub, which sits here, again, post-crisis wraparound and crisis prevention.
Thanks, Kristen. Okay. Good evening, Mayor and Council. Thank you so much for your time tonight. This is really important, and I want to extend a specific thank you to Councilmember Joy, who really encouraged us to come with this particular team and the stories that we're going to talk about tonight to you to talk about something that's really working for us. We talk a lot about what we still need to do. We talk a lot about the problem. We talk a lot about our challenges, but I wanted to really highlight for just a brief moment what's working for us right now. So very quickly, my name is Katie Easton. I'm the CEO of the Downtown Billings Alliance, and I am lucky enough to work with this awesome team that I'm going to introduce you to right now. We have Officer Brad Manser with this Billings Police Department, and I have Callie, who is one of 3 of our peer support specialists who works out of our office, and then I have Cody Christensen, who didn't stand up. You guys have all seen him before. He is our resource outreach coordinator. And these are the individuals, along with many, many partners in our community, that make up our HOT team. Now, this is redundant. Excuse our redundancy. This is the Homeless Outreach Team, but we just call them the HOT team. So forgive us that. If you can think of a better name, we'll consider changing it. But this is our HOT team here. I want to tell you guys what a peer support specialist is. This is the backbone of this program. A peer support specialist is an individual who is successful in recovery currently. And they have gone on through extensive training, and they've received certification to offer peer support. It's exactly what it says. It's to offer support to individuals who they want to bring along and help engage and stay engaged in the recovery process. It is proven that peer support specialists are able to greatly reduce the likelihood of relapse, and that is very important in this conversation. So I could just stand up here and yell at you guys about how amazing our peer support specialists are. They're incredible. I listen to them talking with their clients on the phone all day. I see them out there in the cold. I see them out there on the streets. These guys are doing the work, and they are successful. And this is a program that is cost efficient, it is effective, and it is meaningful. So I can't say enough good things about these individuals. We now have 3 peer support specialists working in our office. They are certified and employed through Rimrock. So the other piece you're going to hear me yell about a lot is the partnerships that we're in. That is what is important in this work. We have created partnerships within this community out of our office, the DBA. Most people think that all we are is events and flower baskets and the purple people, but this is important work, and I am honored to not only be able to house these guys in my office, but work with them and learn from them every single day about the work that we're doing in our community. So the Homeless Outreach Team was created after a group of us went to Houston on kind of an inspirational research trip. And there we were able to see a mobile crisis response team, and we were able to see this homeless outreach team. And so when we came back, work was immediately started on mobile crisis response, and you're going to hear a little bit more about that. That is also extremely important. But we said, we need to do something right now. What can we do right now? And so I was really in a position with the DBA because of our existing cooperative safety program, because of our existing motivated addiction alternative program. We were able to say, hey, listen, let's do this. Let's just stand it up and let's do it. And so we worked with Rimrock, we worked with Jennifer Owen, we worked with a lot of people, and we partnered and said, COSAP grant, let's use it. We've got funding for it, we've got the dedication for it, we've got the desire for it. We can stand it up out of our office. We had these officers who were saying, we can make this work. What we're working on before with the MAP program and not being able to actually arrest people and take them to jail, currently, this is a program that we can do. So we went from the bottom to the top and we stood up this homeless outreach team. And so we partnered with many, many people. We used our previously modeled cooperative safety program. This is a community-based policing effort. And we said, let's do it. We sent them out onto the street. And these guys have made things happen. Their impact is significant. And I believe that their success is impactful beyond measure. However, we all like to measure impact. We all like to measure the outcomes. We all like to say what's working. So let me tell you guys a little bit about what I would say is working. And if you're taking anything away from this, this is what I want you to hear. All of this was made possible through collaboration. The collaboration to get the COSAP grant. The collaboration to visit Houston and come up with a plan. The work together and the partnership to say who needs to gather into this group and offer services to align themselves with this effort to make this program the way that it is successful. And so we worked with the Downtown Billings Alliance, the Billings Police Department, Rimrock, huge supporters, Crisis Center, extremely valuable in the work that they do, Healthcare for the Homeless, which is a Riverstone program, the Yellowstone County Detention Center, Gratitude in Action, St. Vincent de Paul, Continuum of Care. I could go on, and I know I'm forgetting some extremely important partners in this. But if you take away one message, it's that partnership happened. None of us could do this singularly. We've all been trying for years. We had to come together and say, listen, this person can offer something here, this group can offer something here, let's bring it together and make this work. So, what are the numbers? The HOT team, this program was started in August of 2021. And through December, that's only 5 months, the team has served 64 unique individuals through outreach just in downtown Billings. So that's a good number. If you guys remember our community impact statement, we identified 93 high utilizers in our downtown area. Of those 64 individuals that were served, 38 or just under 60% of those were referred to detox, referred to treatment, referred to sober living, and they followed through with that recommendation. That's exciting. Those are good numbers, you guys. We need to recognize that good stuff is happening. They are receiving treatment. In addition to that, our police department and our downtown resource officers were able to leverage all of these partnerships, all of these relationships that have begun between all these service providers, and we went back to the county and we said, man, we really need some space in the jail. We really need some beds because that is a piece to our program that is missing, and we need that to happen. And so the county prosecutor's office, the city attorneys, all of these people got together and they said, okay, we can give you beds, but here's what you have to do. You have to promise us that this is going to work and that you're going to be able to get people through the program and diverted away from jail and into treatment. And so because of that, our officers were able, in that 5-month period, to arrest 20 individuals. We say you can't arrest yourself out of this problem. We've talked about that a lot over the last year. But this is an important factor in our community. We need to have that. So of those 20 people that were arrested, that is far more than what happened in the downtown area in the prior 2 years. Of those 20 people that were arrested, we were able to move them into jail and then move them through the program with the attorney's offices, through the public defender's office, all of this, move them into treatment, get them into appropriate programming that really did achieve that piece that we're looking at, diversion. And then what we see on the other side of that is relationships that are being built. These guys will call and call again and take a phone call and take a text message, go pick somebody up, go see them, go see them, go see them. That is a relationship that will follow a person through treatment. If they choose to do that, we have wraparound that is demonstrated successfully through this program. These guys will not forget about the people that they've helped get off of the street, away from jail, and into a different program. So if you look at all of those numbers, all of those cases that we talk about, what does that mean? That translates specifically into an individual not being on the street, not having contact with law enforcement, which we know costs money. That means that they are not being transported to the emergency department, which we know costs a lot of money. And this is creating 5 months that we are hoping that as we continue to collect data through these partnerships is going to result in a huge public emergency services response savings to our community. That's dollars. That is dollars that we can directly allocate to programs like this because we can tie it to individuals who we are working with. And I say we very loosely, you guys. They are doing this work and they are doing it really, really well. So if that's all that you guys take away from this, come and see them. Come do a ride along with Brad. Come do a ride along with Officer Weston. Come and walk around with Callie or Randy or Jeremiah in our office. These guys are incredible. They are doing great work and they should be commended for it. And I will literally stand up here for another hour if you want me to and just shout about how great they are. So we'll be here for questions, but this team is amazing and they're doing great work. So I believe, am I handing it back over to Kristen? So thank you guys so much.
Councilmember Owen, I hope it's exciting for you to hear that. She's one of the consultants that we hired to help write that COSAC grant that helps to fund this. And sometimes those consultants that write those grants don't always get to hear the reports. We're not always good at that feedback loop. But that grant had to be written super quickly. I think we had about 3 weeks to pull it off. And I think that's one of the benefits when you have a partnership like this where we're organized and you have a plan. We have a plan. So when we're looking for those opportunities, when that opportunity comes along, we're like, that would work. And we can immediately call all the partners and get it pulled off quickly. I've been in this community doing this work for like 20 years, and I can tell you that there have been many opportunities where we have lost the opportunity because we weren't organized. We didn't have a coalition, we didn't have a plan. It would have been perfect for a need. So I'm excited that we see this, actually changing people's lives, today. The next part that we want to do a deeper dive into is the mobile crisis response, and we have Assistant Fire Chief Jason Banfield here to talk more about that work.
How's everybody tonight? So basically, you've heard of all the partnerships that we're already developing and the relationships that we have. When we talk about mobile crisis response, we really look at a team approach to this. And I know that everybody on this panel has gone somewhere, Houston. Myself, I've gone to Spokane and Missoula. And so what this portion of the team is trying to do is we're trying to form what this model will look like based upon our demographics and the service area that we provide, okay? So as I went out to Missoula and Spokane, I saw a few different versions in what they call the behavioral health unit, and I saw the impact of this, because I was kind of a doubter at first. And I wanted to see, what are we really spending on our money and how is this outcome? So I do have a little bit of a story because I spent 8 hours on the behavioral health unit. And one of the 911 calls that we received out there, there was a patient basically that was in crisis that was out of her medication. And that was due to some social economic issues and also one of the family members taking the medications. Okay, so we were able to come inside to that environment. We were able to de-escalate that situation, provide a good assessment, and then provide a diversion area for them to get to. And that's really what the goal is. If you can do this properly, when we do this, we can leave 70% of these people in place. We can do this with safety contracts, keeping them there, and really de-escalating that situation and getting them to the proper service areas. Okay. So right now, this group, obviously we're right in the middle of draft policies, trying to figure out the logistic sides of these things, and also the protocols for the medical portion for the assessment. Obviously, we're looking at money. That's the draft budget that we're coming up with. And our goal also for this is to alleviate some of the police response in the future. And if we could form some relationships with these patients on the follow-up side, that may be something that we can decrease some of those police responses and also fire responses. Obviously, on the bottom, you're seeing just the partnership that we have. Everybody's really leaning forward this, and like I said, I was kind of a non-believer at first, but as you see these models create some impact, and they had kind of a cool way of doing their documentation. They were able to touch tablets and see that medical information. They're integrated with their healthcare over there. So the cool part of that is I saw how many times they had visited this home. And what had happened is you saw a decrease in the amount of 911 calls to that. Instead of every third day, they were going every 10 to 14 days. And that was proven by the medical reports that they were producing. So on that, I'm kind of done with that part. I know it's a 30,000 foot view, and if you just kind of give us some more time, we're obviously working on the logistic issues that are coming at us too. So.
And then we'll just turn it over to the chiefs.
Yep. Chief Valdez will be next, and then Chief St. John.
Absolutely.
Wow.
We will pause if you need a genuflect, go ahead.
So sorry you had to look at those two ugly mugs up there. Good evening, Mayor, Council. Thanks for having us. As you've heard, this program has many benefits for our community, and this group has made quite a bit of progress in this. I have had the opportunity to review several programs myself, and which come with many different combinations. The first one that I took a look at was the Boost program. Councilmember Parrington, I think you brought that up several times. That particular program is out of Eugene, Oregon, and that one's run by PD. The other one, as Chief Banfield had mentioned, was the CARES program. What we did there was sent 2 individuals to Spokane to study their system and see how that would work for us. And then the latest one, probably been up and running for about the last year and a half, is the CIT Montana program, which is out of Missoula. All very beneficial and have been positive impacts for their communities. As far as the BFD, this actually is in line with our CPSM report. It's recommendation number 21, says it right in there. So forging ahead with that, along with the collaboration with everybody in this community. For us, this allows us to have a high state of readiness, and it keeps our resources available for more emergent and those labor-intensive calls. This also puts the appropriate people with the appropriate resources on that particular call. It also helps to reduce response times in the future, and in the future, the potential to reduce on-scene times. You guys have heard me talk about efficiency ad nauseum. This gets us a step closer to that. It also allows for more multi-company training and drills for us for preparedness. And lastly, it reduces the fleet maintenance and fuel costs for us. So this indeed has the potential to be of great benefit for our community after learning what works for our city and our specific needs. As you guys understand, this is not just a police and fire problem, this is a community issue, and we're very happy that everyone is taking a bite out of this big apple. With that, I'll turn it over to the Chief.
Thank you, Chief, Mayor, and Council. Good evening. I know there was some confusion about when to call 988 and 211. If you look at that long enough, you'll know what a crisis now is. Having to look at that all night. I know I'm ready to call. So, well, everybody's kind of talked about the 30,000 foot view, and for me, it's a 50,000. Both police and fire fully understand we cannot subrogate public safety. It's our responsibility through and through. So when these systems get in place, when we are providing services, whether it's mobile crisis or some of the services to divert, we are ultimately responsible for the safety of the people that we're serving and the people that are providing the services. And so that cannot be subrogated away or offloaded, if you will. And it's a very, very big concern, and we make sure that things are thoroughly vetted before we engage in anything like that. Second of all, we fully realize that the calls for these type of services will not reduce simply because we are employing a new technique. But what we do anticipate is that the time that we spend on these specific calls will be significantly reduced. Therefore, we can get our assets, whether it's police, fire, off doing other things, which falls squarely into Cpsm Recommendations, which addresses your efficiency and effectiveness. For the police department in particular, one of our strategic objectives is to support our partners in dealing with the co-occurring mental health and addiction issues. And everything that you have heard here today supports that, and we've seen some of the successes as well with Katie's team. Again, a lot of moving parts here, but there's a lot of people that are working really hard to get some things done, and I think you're seeing that. And we would really appreciate your continued support and look forward to putting new programs out on the street as quickly as we can get them up and running. Mayor, that is it, I think, for this group. We'll entertain questions.
Okay, thank you very much. Council, you've heard presentation by all 5 of those little mini groups. So we'll open up for questions. Just ask that you clarify who it is that you'd like to answer your question if you know. Councilmember Gulick, Councilmember Nice, Councilmember Joy.
Thank you, Mayor. And a question on the mobile crisis teams, what's it looking like in terms of when they'll be implemented timeline-wise?
Do you want? Well, I'll say it. I mean, nobody else would be responsible. As soon as possible. I mean, in an ideal world, we were hoping that we could get mobile crisis up and running the same time 988 launches, but we're not sure, right? That gives Assistant Fire, that gives Chief Banfield heartburn to say that, right?
Yeah. So basically, what we're looking at some logistic issues. I mean, for example, we're looking at a vehicle right now. Where is that coming from? Who's going to provide the maintenance? All those little detail effects that are coming. We're also looking at the protocols to the physician. Is he going to approve those? Are we able then to support and do the assessment with the patient with the blood alcohol of a certain level? So we're looking at all these, and it's going to take some time to push through. Some of that also is a money support issue and how we're going to have some sustainability with it. And then the other portion also is through the safety mill levy, some of that money is going to support some of this. And you guys know that doesn't start till July, and then of course that money doesn't actually show up until December. So we do have some early support things. Sorry, Chris, go ahead.
No, Mayor, can I just add a component?
Please.
So one of the things I think is real easy to get confused is between the medical response teams and the mobile response. So, and whether these acronyms or these names will stay long-term, but what we're calling today medical response teams, that's what was recommended in the Fire Department Center for Public Safety Management analysis as a more efficient way to respond to the roughly 20,000 calls of service that we're responding to today. So that's, whereas mobile response is more integrating mental health and services outside of what the city supplies, but that's got to be coordinated with law enforcement and or fire or both. And so that's, Jason's working on both of those fronts for us as a city, and they're both critical, both a part of the Cpsm recommendations and both a part of the strategies with Substance Abuse Connect, but I think can pretty easily get confused as to are they one and the same. They're not one and the same. They are two different responses, and we're learning from other communities, they're deliberately two different groups.
I just want to add, in terms of time constraints, Rimrock is bringing the behavioral health component to it. So, the time to get all that into place, and they are bringing, back to this public-private partnership, I do think it's important for people to know that, Rimrock is bringing money to the table. They have a grant outside of this that they're bringing to the table to get the behavioral health piece stood up, and then they are looking at how they will be able to sustain that when the grant's gone through billing. So, being careful, just as we're doing with the Project Hot team, that's been grant funded, but with Rimrock's working super hard to sustain that so that when the grant goes away, that's going to be, so anyway, that's just another factor also, of course. There's the public and the private side.
Okay, thank you very much. Councilmember Neese and then Joy.
Thank you, Mayor. I do have a couple of questions, and I'll ask this one. This is for Chief Valdez, I think, because it's the 911 center. It looks like we're going to start, if you dial 988, and I got to try to remember that, if you have a crisis, but if you dial 911, it'll be diverted to 988. So will 911 then also roll all units like they do now, roll the police, roll maybe the fire department mobile response versus the crisis mobile, and then will crisis mobile roll? Will everyone start rolling at this if it goes to 911 first? And then also, I guess into that, if they dial 988, will fire department, police department also be rolling at the same time?
So I actually have Derek Yeager. I believe he's online. Yeah, he's up there. Derek, can you hear us?
I can. Can you guys hear me?
Yes. So
Okay,
Derek, if you can answer that, it'd be great.
Yeah, thank you, Councilmember Neese. So as Chief St. John mentioned earlier, there's still an obligation at the 911 center for every emergency call received to vet that to some degree. We are looking at some expanded interrogation, questioning line of callers, trying to determine nature of the crisis or the emergency. Is there a threat to the public? Is there a threat to oneself? What's the manner of emergency? And does it necessitate police, fire, and ambulance? I think when we eventually over time have the assets and the resources developed, deployed, a little bit of proofing. There's the possibility of diversion, but I think at the forefront, the majority of the circumstances we entertain at 911 do encompass some manner of necessary law enforcement and eventually fire and medical response. So with the advent of 988, I think there's going to be a lot of coordination, especially up front, that's going to have to happen between the calls that come in on that line and how they impact 911 and the calls that come in on 911 and how they could be possibly and potentially futurely averted to 988 into a behavioral health situation.
Okay.
Does that answer your question?
I think it does. Mayor, quick follow-up on that is, so the 988, is that going to be handled by the 911 center, or is that going to be done by the crisis or the, Kristen, your organization? And then, so will you then call 911 if you think you need someone to come out there with you?
Do you want me to take that, Derek?
I can grab that. So currently, the 988 and the 211 numbers ring into respective call centers and located currently in Great Falls and Bozeman. And we do take calls directly from those centers, from those counselors who have patients online that are exhibiting law enforcement or medical need type situations, whether they're armed, whether they've already attempted any manner of circumstance. And so there's already a communication line present with those services. We are in consideration now looking at the logistics of what if we began to take those calls locally here in Billings. What does that look like? What does it look like to install some counselors in the 911 center for call diversion, for advice and counseling in the center? We're all looking at a number of options that could be everything from keeping those calls going to Great Falls or Bozeman to having them come here.
Thank you.
Thank you. Councilmember Joy?
Thank you, Mayor and Council. I think my question is for Kristen Lundgren. I just wanted to know, on your handout, you have a flow chart, person in crisis, and the various steps and diversion. There are numbers at the top, there are percentages at the top that show, are those numbers that are based on previous experience? Are those numbers that you hope to achieve? Where do those numbers come from? Thank you.
Yeah, very good question. So it's hard to read the footnote there, but those numbers come out of this 2020 report and research that has been done when this model's implemented, fully implemented, that these are the results that they have seen from their study of when these programs are fully implemented. So we also have, these are not those numbers, but similar numbers from when we took our trip to Houston in terms of the numbers that they see, the diversion. So in their case, they've had a effective crisis line embedded in their 911 for some time, so they've got good statistics on the number of calls that get diverted out of 911 to their 98, et cetera. So yeah, but this set of numbers comes from research in other communities.
Thank you.
Thank you. Kristen, if I can ask you, what do you foresee as the long-term combination of these teams? We have the potential medical response team, the medical response team, the mobile crisis team, the HOT team, and the MAP team. That's going to be confusing, potentially inefficient, and if nothing else, just politically dangerous, because it's going to seem like it's all sorts of overlap and inefficiencies. So what's the long-term goal, do you think?
Long-term goal is that we reduce the crisis in our community and we get people into long-term, housing, stable housing, and we're not seeing the crisis with mental health and homelessness. So long-term, that's the goal. In terms of the confusion, that you talked about, from where I sit, no confusion. I understand from the public side that may feel confusing, but I do think this diagram is really helpful in that regard. When you take the team that Katie was talking about, let's just look at this side.
Kristen is right on the
Oh, thank you. And I'm gonna just maybe click ahead or click back. Oh, that's
can't
this.
click,
Okay,
sorry.
never mind.
We couldn't blow it up by clicking, so.
Okay, well, Katie's team is over in that last bucket where it says post-crisis wraparound. They are interacting with individuals who are not yet being, seen by mobile crisis. They're not yet being, and these peer support individuals are following these guys through the whole system. So it's an entirely different thing, and the public can't call. There's not a number to call for anybody to call, say, hey, can you deploy the hot team over here? I mean, it's a different type of thing. As far as mobile crisis, that is going to be a public resource eventually, where, it's served through fire, police, and that collaboration. The reason we're building mobile crisis with the fire department and the police department and the sheriff and 911 is just to avoid any confusion. So there will be no confusion. The mobile team will deploy when there's a crisis, and yeah, Brad can answer that too. And I don't know what was the third team you talked about? I can't remember, but yeah.
So I'm Officer Manser. I appreciate the opportunity to speak in front of you today. To the other side of your answer, Kristen has the organizational head answer, the way you get from a director. The boots on the ground answer is every one of those organizations or those teams serve its own population. So the hot team is for the transient homeless population downtown, and that's our only focus. So we focus on substance abuse, and then after the substance abuse has been worked on, then we can work on mental health and other concerns. Everything's usually co-occurring. The medical response team, they're going to have their own subset and why they're going to respond, so they have their own specialty. The mobile crisis team would then have suicide threats, that acute harm to self or harm to others, mental health or substance abuse is contributing. And we kind of think about it like treatment courts. We have a camel court, steer court, we have a court for every type of offender given the situation. We have it for domestic violence. And so this is kind of that same concept is instead of having one big team that kind of does everything okay, jack of all trades, we have the individual smaller groups that are excellent in what they do, and whether they're provided through our treatment providers or the police department, the fire department, we can specialize and then go out and tackle those problems individually with our unique skill set. So that's kind of the difference on the ground level of each team.
Okay, thank you. Other questions?
I want to say one more thing, just in terms of efficiencies. So part of the model here is there's got to be some kind of air traffic control. And that's part of why being at a table, together, there is some kind of air traffic control. So in terms of deployment, 911 dispatch, we don't overtake that activity. The other thing is, having real clear understandings between all of us of what Brad just described, right? So when an individual is in crisis, we know exactly where to get them. This is appropriate for the hot team, and we, in our coalition, we call this the playbook. That we are working on the playbook, and that the current circumstance is where you do, pretty much have everybody on their own developing their own playbook, which is very inefficient. What this group is working towards is putting all our efforts together towards one playbook. If this, then this. If this, then this. And that's the same playbook that's needed by 988, that's needed by 911, with a little variation that's needed by Warm Springs when they discharge to Billings, or that's needed by the Crisis Center when they discharge, back into the community. I think you'll see a lot of efficiencies also through being together in this work.
All right, thank you. Councilor Pierce, you had your hand up, is that true?
Well,
No?
I did, but between you and Chris's statement, answered.
Okay,
Thank you.
all right, thank you very much. Any other, Chris?
Can I add to that? What I heard the chief say that I think, really simplifies it and hits it. He commented, police and fire aren't going to see fewer calls, but the time spent and the handoff or who specializes that service will be far more efficient than the old school line of thinking, which is, are we taking them to the jail or are we taking them to the emergency room? It is getting much more complex, but the complexity is about catering the service to the need, which maximizes the resources, the public, particularly public and nonprofit resources that are going into the system.
Okay, thank you. Questions? We'll want to leave time for public comment here. I'm sure there'll be some. We also have a lot of team members here who also may want to comment. Councilmember Purington and then Councilmember Owen.
Thank you. So I think that's my big concern. And the chief might be able to, Chief St. John might be able to address this, but given the current situation with violent offenders in Billings, that we continue to see, crime, and it's very violent, is sending out these mobile crisis teams, whether it's the behavioral health or the medical response, is that I just have a concern that police officers need to be there because you know yourself how quickly these things turn around. And even the police department has come up with different policies of just one officer responding. So do you have a comment as to how you foresee that in the future?
Well, Councilmember, you're absolutely right, and that goes back to my original comment, is we need to make sure everybody in the process is safe. If we just stay with what we're doing, we're sending at least 2 officers, and we know that's not efficient. The little catchphrase I came upon is care, not cuffs. And so the whole idea of this thing is to for us, a very quick handoff to the appropriate service and get our officers back doing what they need to be doing rather than spending an hour trying to figure out what someone's problem is, taking them to the hospital, taking them to jail or wherever the case may be. That's what the whole goal is. So at the end of the day, I can see that we're going to respond regardless of the model. It's how long we spend on task is what's going to be the difference in what we're proposing here. We will turn around a lot quicker once we make sure everything's safe and be back in service to handle additional calls. The other model on the other side, we stay there till its entirety, till we tuck them in somewhere. Because as I mentioned before, when we get sent and fire as well, we own that person. So dusting them off and sending them down the street to get hit by a car or something down the road is not always the appropriate answer. So either way, you're going to get an officer. It's just a matter how long they spend on tasks down there. I hope that answers your question.
It does. Thank you.
Thank you. Councilmember Owen, Councilmember Neese?
Mayor, I'm wondering if there's a chance Lynette might be willing to field a question.
You bet. Lynette Kosovich. Whether she wanted to or not, she has been...
I'm not ready to go get dinner. She's here. She has to do it.
I appreciate that because, Lynette, I think you've been at the helm of Substance Abuse Connect since the inception, and I think Rimrock has a really unique perspective on the core of this work, which is substance use in the community. So I think it's important for us to be candid because I think candor is where we start to get to solutions. And so in all candor, we're 3.5 years into this effort, give or take, and millions of dollars in, millions of tax dollars. HIDA grants, cost of grants, money from the county, money from the city. There's been a tremendous amount of coordination and meetings and white papers and studies and mapping. I was thrilled actually to hear Katie's very exuberant presentation tonight because it's the first time in 3.5 years that I've heard somebody say measurably, here are people who are better off because of this work. And bless their work because it's incredible work, but it's still a very small number. So as sort of the person who looks at substance use in this community, when do we start seeing actual impact? Not people hired or grants won or studies done, but people getting treatment. Reduction in overall uses of substance abuse, reduction in, the HIDA target of young men who are selling drugs and using drugs. When do we start to see real numbers of impact, not just input?
We have seen those numbers. We do a terrible job about telling you about those impacts. And with all these programs that we've talked about tonight, we are required by many of these grants and from the state, because we have a large population that is Medicaid eligible, we are required to produce an outcome study every single year, and we do it on every single program. And we're seeing things like homelessness reduction, increase in employment or betterment of the employment that they've had, increase in education. And I could send you a copy of it. Our 2021 was just published about a week ago. We do a terrible job about talking about these results. It's happening. And we have seen a trend that has of improvement for probably the last 2 years really strongly. And I'm sorry we haven't shouted from the top of the roofs. This is a good start. We as a coalition talked about, we needed to be here to talk to you about some of these results. These stories like Katie just told, I hear them every day or I see them. And it is very heartwarming. We just need to push them out.
Yeah, I would love to see that data. And if you would do me a favor at least and strip out all the inputs. I don't want to know about people you've hired or any of that. I just want to know people in treatment, people getting jobs, actual impact in the community.
What we really look at is quality of life measures. The DLA 20 is kind of the basis of what we ask. And we look, how are your relationship? How is your mental health? How's your physical health? How's your addiction going? Are you employed? Are you educated? Are you safely housed? All of those quality of life measurements is what we look at, and it's very sophisticated. Many of you have heard this before. Some of the studies, the study that we do, they do a baseline study when they come into our programs, and the peer support specialists do these really frequently. When people leave our service, we do one at 6 months, and then we do it again at 12 months. So we have this continuum of data, I guess you'd say. We have one person that has worked with us for 25 years that calls these people at night, and we have a 30 to 35% response on these. I think they think they're talking to their grandma. She is a rock star, and if she ever retires, we're in trouble, but I've never seen that kind of response to surveys. So I feel very strong about our data.
Okay, yeah.
Okay, thank you. Lynette, before I pass it to Councilmember Neese, I just have to have one brief follow-up on what you just said. Is it correct that what you're talking about is success in people who are served, but not necessarily a net reduction in the overall community problem? So that if we have more people coming into the system, we may still have a net addition to the problem, even if individuals are being served and having good results. Is that correct? You're talking about success in individuals, not necessarily net to the entire community.
Yes and yes. Many of our people that we get have some criminal involvement, and we measure that too. With some of the things that we're doing now in this whole crisis continuum, that's where you're going to, I believe this, that's when we're going to start seeing a net change to the community, where the community will start saying, I'm so glad I live here because this is a safe community. That's what we're going to be producing.
Okay, thank you very much. Councilmember Neese, you had something, and then
we can expect to start to see quarterly reports with those kind of outcomes. We are bringing on an external evaluator, and just agree, we do not communicate well. But that's something that you can expect to see in the future is our quarterly outcomes and an annual report, as well as to whether we're making progress, along with this team doing continuous quality improvement meetings where we look at if there's no net change, then what, right? We aren't going to keep doing things that don't work, the idea. So the idea is to have the measures, have the quarterlies, and have the CQI structure for us all to do together.
Okay, thank you very much. Councilmember Neese, why don't you wrap us up? We need to take a break, but we want to hear from the community before we do so. So, Councilmember Neese.
This is actually for Katie.
Katie Easton.
Katie, I think I recall you talking about this program when you were presenting it to us, and one of the questions I asked about this was, are you going to roll this out to the whole city? I mean, you said you're going to test it downtown. If it's successful, we could roll out to this other city. Because I hear from constituents in the Heights that there's people sleeping in the back, there's homelessness up there. It's really all throughout the entire city. And before you answer that, I want to say this is really great results, as Councilwoman Owen said, that it's great to hear that. And so you mentioned like 90 people are down there, the problem people downtown. You guys approached, I think, 60 or 38 of them, and 20 have been successful in monitoring. Can we assume, again, as far as the results, 90 were on downtown. You've successfully addressed 20, so we have 70 technically. Of course, people could add to that. So there's kind of a two question here. One is really what is the measure results of the community downtown as far as what has been reduced, and then also how can we see this roll out to the city if this is this successful as this?
Thank you, Mayor and Council, Councilmember Neese. I really appreciate that question because it does allow us to really talk about how we are creating a program that can be data-driven and trackable, be able to really present results in that. And so I would say that a big piece of this was revisiting our community impact statement that we did release to you guys, which identified 93 high utilizers, and really trying to consider the cost of those high utilizers to our community as a whole. The Downtown Billings Alliance is used as kind of a test pilot arena a lot, partly because we are a very identifiable boundary. We have identifiable resources. We have a lot of freedom that council gives us through our work plans for the Business Improvement District. We have the very successful cooperative safety program in place. And so we were able to take that program, put it out into downtown, and measure it within a very specific boundary. That program is absolutely something that we could launch across the city. The numbers, and part of what I think the work that Kristen's doing and Substance Abuse Connect as a coalition is doing is really committing to gathering the same data. So let's talk about it using the same words, collecting it through these different evaluations that the individuals come through. Are we all speaking the same language in such a way that we can then go and speak the same language as we look at the whole community? We are kind of piloting that downtown, and it's easy for us to do. I would say that one of the pieces that is really works for us, which we're encouraging other neighborhoods of the community to really evaluate, we're working with Wyeth Friday on this. We fund our program primarily through the Business Improvement District. This is driven primarily by the property owners within that district. They want to see this cooperative safety program happen. And so we have some freedom in how we can use those funds to implement a program like this. We've met with the Midtown Task Force to talk about their hopes to maybe create a bid. I would encourage the Heights Task Force and those neighborhoods to continue their conversations. This is a funding source in which programs like this can then be implemented and then targeted amongst a specific boundary. So I would say that that's what worked for us, was that specific district and boundary, as well as having a work plan that had a lot of flexibility within it. That data that we did collect is going to be continuously collected. Officer Manser is working really hard to kind of create that program that we're going to track those high utilizers, who is still in the system, who has seen a measurable deduction in their law enforcement contacts, and I think we'll be able to continuously release that program and then hopefully have a really solid set of reporting data to come back to you guys with to say, here's what's working, here's maybe what's not, here's maybe how we have to pivot. And I would say I'm honored to be a part of that program because we have the flexibility to pivot, maybe with a little less of the restrictions that some of these other organizations might have to do. And so I'm honored to be that test pilot. I'm willing to do it. Sometimes they have to drag me kicking and screaming through it, but I'm always happy when I do it. And so I hope the data is going to be there for you guys to see again and again and again. And then I would absolutely be available to talk to any of these other areas, task force, neighborhoods, about bid creation, cooperative safety creation, all of that. So.
Great, thank you very much.
You.
I appreciate it. Thank you for your team for what you do down there. So appreciate it. All of your organizations.
Thank you, Katie. I'm going to just address the people in the audience today. We're about 8 minutes past when we usually try to take a break. I'm going to ask how many people think they might want to offer public comment on this item. If it's a large number, we may take a break. If it's a very small number, we'll probably just go ahead. So you're not bound by this. We're not going to be photographing who raises their hand. But if you think you'd like to comment on this topic, would you just raise your hand so we have an idea on that? Oh, good. Okay. Well, then we will open it up for public comment on item number 2. And again, you're not bound by that. Although we do ask you, if you do comment, keep your comments to 3 minutes or less, and tell us your name and address. So this is a public comment period on number 2, item number 2 that you've just heard. If you'd like to comment, please go ahead. And we do have time for a couple of comments if you'd like to. So please, do we have any public comment here on item number 2?
It's 25 online.
Yeah. Kevin, do we have anybody online? Do we have anybody that you know of? Okay. Scar, it's all yours. Go ahead.
Catherine Card, 2815 4th Avenue South. My question would be, because a lot of the homeless folks are in different parts of the town besides downtown, quite a number are in the Heights, quite a number are on the West End now. So is the HOT program reaching out to those communities of unhomed people?
Okay, we'll take it. We got the question, but let's not get an answer to that quite yet until we find out if there's other public comment. Is there any other public comment on item number 2? Nothing online, you said, Kevin? And nobody is coming to the podium? Okay, we'll close the public comment period. And Katie, if you can just address the application of the HOT program outside of the downtown area.
Thank you so much for the question. I think that this is an excellent question, and it really does get asked of us a lot. What is our boundary? Who are we serving? I use it loosely. This team is really willing to answer any calls for this. The COSAP grant was written in particular with the intention that it could be expanded. It was written specifically, like I said before, for the downtown district because that was easily measurable. Now, the business improvement district in which we wrote our program in for is quite a large area. We extend all the way South Park to North Park, MSU Billings, down to the refinery boundaries for our cooperative safety program. And so our police officers respond to that entire boundary. It's quite significant through the hospital corridors, extending even into the Ebert area. So by just geographic nature, we would go anywhere. Our HOT team really experienced the aspect that there ended up kind of being where there wasn't as many people downtown for them to even go and talk with and have outreach with. And so they took it upon themselves to go to other areas of town where they knew some of their clients that they had interacted with before might be. So, short answer, it is easily expandable. Our bid extends all the way into the south side down to South Park. So, does that answer your question?
Very good. Thank you very much, Katie. Much appreciated. We'll conclude then item number 2, take a break, and come back for item number 3, our Stillwater building up. It's update. It's 7:42. We'll begin at 7:50 or earlier. Okay, all right. So Kevin, or Jessica, if you would introduce yourself, and it's all yours. And just, if you would talk into that microphone there, perfect.
Okay, can you hear me?
Yes.
All right, thank you, Mayor. Thank you, Mayor and Council. Jessica Iverson, Facilities and Building Division Manager. Here this evening to give an update on the new Law and Justice Center City Hall facility, also known as the Stillwater Building. We're still in phase 1 of the design. So this evening, I'm going to go over the project methodology, our guiding principles, the survey feedback that you all filled out for us, our timeline, an update on where we are on phase 1, and then sort of looking forward, and at the end we're going to have some discussion and specific questions that staff is looking for direction from council. So those 3 items that we will be asking for feedback on at the end is our guiding principles for the project, the level of sustainability or high performance efforts for the project, and then also Kevin's going to talk a little bit about historic tax credits and a potential opportunity there. So just talking again about the project methodology for how we're approaching this project. So we look at it, it's these 3 important parts as we're looking at the strategy, the roadmap, and then the plan. So strategy is our overall vision, goals, and why for the project. And then what are we designing for and what decisions will we make? So we set up, with our design team, staff developed these guiding principles, and those inform our strategy for the project when we're making specific decisions as we're moving through the design process. So the roadmap for this project is our specific milestones that we're meeting. Those are deliverables from the design team. And then there's also these key touch points, and that's when we're looking for direction and input, whether it's from department directors or council or city administration. And then our plan that we're putting together is specific action items, and then what those outputs are. So the project guiding principles that we've developed with the design team are fiscal responsibility, for instance, providing innovative cost-saving solutions, resiliency, which is really about long-term solutions and a low cost of ownership, efficiency, meaning things like reducing experience failure and efficient use of resources, and then meeting the community's expectations. So serving as a destination and foundation for the organization and improving service deliverability. And those have really served to influence and guide the decisions that we've made up to this point. So as you know, when we did the council survey, we sent it out to council and mayor, and we asked for some input based on our guiding principles that we've been working with so far. And a lot of it is we just want to make sure that we're in alignment with what council's expectation is. So I went through all of your surveys. We received 8 out of 11, so I'm not going to call out who we didn't receive them from. But there really were some important themes that threw out, and it was really things that we found in most of the surveys that were in agreement. And the 3 big key points that I picked out from the surveys is that you all want a building that is welcoming, has a positive image, a safe environment. You want a facility that's engaging, it's approachable, it's easy to use, and then efficiency, both with use of the space and also use of energy and resources. So those were the 3, I'll say, key themes that I picked up from the surveys that you all provided. So when we look at our guiding principles, now my clicker isn't working. No. Oh. Okay. So even though those did fit with some of the guiding principles that we already had established, we felt that really we needed to add one more, and that was user experience. So under user experience, to us that means positive engagement for staff, visitors, and citizens, an innovative work environment to attract and retain top talent, provide positive experiences for visitors, be a welcoming destination, and then engaging with the surrounding streetscape and neighborhood. So really, what we're proposing are these 5 guiding principles for the project. So the original 4, and then adding user experience. And so again, these guiding principles are serving to influence and inform the decisions that we're making as we're making design decisions with our design team through the process. And then now I'd like to introduce John Caterino. He is the facilities superintendent, and he's been working with me a lot on this project. And he's going to talk about our project timeline and then where we are in design phase 1 and looking forward to the next couple phases here.
Thank you. Good evening, Mayor and Council. So we are still in phase 1 of design, and that is slated to end in March. And then after that, we will progress into phase 2. More to come on that in the next slides. So what we have here is a 3D render model of the Law and Justice Center / City Hall. And it has each floor blown out. It's currently in a program phase. So we don't have any specific divisions tied to these locations, but what we have is program space, so we can see where our adjacencies are within the different departments, and then also where currently our tenant spaces would lie. So the areas of blocks include space for each division, meeting rooms, and tenant spaces. This is the second revision in the option that we chose, so we will most likely see changes in this program space as design elements progress. So what we have here is a snapshot of both the gross and the net square footage of the building footprint. So the gross would be the total building from the outside of the exterior walls, and then the net is the inside of the walls. Deduct any existing non-usable space, such as columns, mechanical spaces, shafts, etc. So as you can see, we have a much higher gross square footage on each floor. But then when we program the space, we have a lot less usable space for our specific departments that are going to be moving into the Law and Justice Center. So what that ends up netting us is designing space on 5 floors, which we didn't initially anticipate. We thought it would be more along the lines of 3. So that has really decreased the amount of space available for us to potentially lease out to tenants. So our design team has initially come up with a gross program space of 78,000 plus some change square footage, which leaves us almost 38,000 square feet of unprogrammed space.
And John, these old eyes do not see what that net usable square footage total is, except it starts with a 1.
Yes, Mayor, thank you. That is 116,680.
116, so that's almost a 50% reduction from gross to net.
That is correct.
Can you explain, because that's way very different from what we were expecting to begin with?
Yeah, that's a good question. So one, that is taking into account the spaces that are grade plane and above, so floors 1 through 5. We don't take the basement into account because we're not going to have office space in that location. And when we look at the gross square footage on each floor, we're roughly 33, almost 34,000, except for the ground floor, because we have the drive ramp and then the walls are inset, so you don't have the same amount of footprint on the first floor as you do the remaining. And then also we have roughly 13,000 square feet that is currently leased out to the county on the 3rd floor.
Okay, so we would have that if once the county leaves.
Correct. What we have here is a proposed area needed for each department. So it's listed out by the department, their net and gross areas that are required, and also their full-time equivalent head count. And that includes council chambers and our emergency operations center.
And I assume everybody will get copies of these slides after our presentation. Everybody's going to want that. Yeah, because we really can't see that, but we're going to want to study it. So
I apologize. They're in their 20s, the rest of us.
I wish.
Well, we'll get copies. We'll
Yes,
get copies.
we'll get you copies of the slide deck.
So next, we have the construction manager at risk process, and it is an alternate delivery project method where a construction manager is selected through the RFP process, which we've gone through already. And that is instead of taking the lowest bid. So what's important about the CM process is that it serves as a consultant to the city design team during the design and pre-construction phase, and then they will serve as the general contractor during construction. So they're responsible for securing the services of subcontractors through a competitive bid process. So that takes us off the city's responsibility to do that. Then the CM is contractually bound to deliver a final built-out space with a guaranteed maximum price. That means that the construction manager is financially at risk to provide that built-out space and any cost overages that are above and beyond the GMP that are not approved change orders have to be absorbed by the construction manager. Some of the benefits to the city by going through this alternate delivery method is that the construction manager serves as a cost controller and the general contractor. They provide constructability review for us, and they review the accuracy of estimates for budgeting during design. So we get to a much tighter number. We can understand what's in scope, what's out of scope, value engineer accordingly. The construction manager assists with the value engineering. They provide cost-effective alternates and design solutions. The CM provides the city better cost estimates for construction. They are the party that manages project and logistics. And then there's a higher level of accountability through subcontractor qualification and vetting process, as we're not required to select the lowest bidder. And as we've seen, we've had some challenges with selecting the lowest bidder in the past. So what's important to remember about the CMAR process is that because it's an alternate delivery method, is that the city requires pass a resolution to utilize this delivery method. So on the March 14th agenda, you will see that resolution on consent. The project meets the requirements of Montana Code Annotated 18-2-502 as an alternate delivery method. So currently in the RFP process, we met today as a review board. We evaluated the proposals. We've selected our top 2 firms, which we're going to schedule for interviews for next week. And then once we go through the process of selecting the firm and contract negotiations, you will see a contract come across at the 3/28 meeting for approval. Phase 2 design preview. Phase 2 is an extension of Phase 1. The big takeaways from Phase 2 are we get the construction documents for bidding, and we get cost estimates of 50-90%. So that gets us a really good idea of what is going to be in scope, and then the opportunity to value engineer accordingly. The negotiated guaranteed maximum price with the contractor also comes out of Phase 2, and that contract will come to council for approval as well. And with that, I'll give back to Jessica.
All right, thank you, John. So I just wanted to recap the direction that we're looking for tonight, being any input on the guiding principles that you may have, and then our level of sustainability, high performance that you'd like us to achieve or look at achieving, and then the historic tax credit funding. So going back to these 5 guiding principles, so that you'll remember those for when we get to the discussion part. And then I just want to talk briefly about sustainability and high performance for this project. So we did have some survey responses where some of you specifically asked about the building meeting certain goals for sustainability or high efficiency or high performance. And we felt as staff, a decision like that, of course, would need to come from you at a policy level. So we need to get clarity on the topic. When we say sustainability and high performance, what is meant by that, and then what goals should the design team have in mind as we're working through the process, and also how does that sit as a priority compared to other priorities that this project may have. So our question tonight is, what level does council direct staff and the design team to incorporate sustainable and high performance design features into the project, and then based on what metric? And then are there specific areas of interest that council would like us to pursue, such as life cycle cost of ownership, energy usage, efficient building systems, specific things regarding interior environment or finishes, and then any specific metrics that you would want us to achieve as part of the process, or attempt to achieve, and to what level. And then Kevin is going to talk a little about historic tax credits here.
All right, thanks, Mayor and Council. So just a couple things. I got a crash course on historic tax credits late last week. We met with Randy Hafer, a local architect, and then also met with Adam from a company out of Virginia, I believe it was, Virginia or West Virginia, that his company deals a lot with the tax credits and writing the proposals and things of that nature. So just wanted to give you a heads up on this. There is a potential for about $3 to $4 million in gross tax credits that could be achieved from this product if we qualify the building under the National Historic Registry. There's a big, long process that we have to go through to do that, to get the building added to the registry. The first step is through the state, getting hold of SHPO, having them come out, hopefully come out and take a look, picture documentation, things of that nature. If it does get added to the registry, and then we are qualified for those tax credits, there's a contract that would need to be done with a company that does specialize in these tax credit proposals, I guess is the best way to put it. That our understanding is, their rate fee is about 7 to 11% based on the tax credits that you get. So there's going to be a little bit of reduction in the gross tax credits from whatever company we would have to help us with that. The second thing out there, and how this works, so we're a nonprofit, non-tax paying entity for those. So how this works is there's kind of an intermediary, and I'm trying to stay at about 100,000 foot because it gets complicated in the weeds quick. But you partner with, let's say, a financial institution in something like this, and then you, in that partnership, maybe it's a loan through a financial institution or something. They're a partner with you in this. What they do is they end up coming in and they buy those tax credits for 85 to 90% on the dollar. And with that, then they use those tax credits for their entity, thus transferring that 85 to 90% on the dollar, back to us in the form of funding source. So we wanted to make you aware of this because it is out there. Net on a $3 to $4 million gross tax credits, we're estimating it could be, $2.5 million, somewhere in that range would probably be a very conservative estimate. We would certainly want to nail that down and bring you more information. But what we're looking for tonight is this something that we want to kind of look at and go forward? Some of the consequences of doing this, and I think probably the big one is, normally the exterior of the building cannot be changed. Okay, so that means that, the concrete wavy entry arches would have to stay, things like that. So there can't be any real major changes to the outside facade of the building. The interior stuff, again, we'd have to find out what we could and couldn't do. There could be some consequences, might not be nearly the consequences of trying to do something on the outside of the building. So that's one of the things that council would have to consider, as kind of that policy direction. Do we want to try to go down this road and do this? There will be a little bit of impact on our timeline if we do this, just because we do got to deal with SHPO and get that process rolling. And we want to kind of get that in place probably before we get too far into phase 2 of the design process. So with that, that's my piece of it tonight. Now we're ready for some questions and discussion. And I've got it over here.
Okay, we've got lots of questions. I guess we'll just go wherever you want to go, Council. I saw lots of hands. Gulick, Joy, Boyette, Purrington.
I'm happy to act as a informational witness, I guess, on historic tax credits. We have used those on projects in the same with nonprofits, such as right now we're doing one in Lewistown with One Health, a community health clinic. And so I'm also familiar and can augment perhaps what Kevin might have too. So just know that I'm a resource.
I'm sure we will make use of that before we're done tonight. Councilmember Joy and then Councilmember Boyette and Purrington.
Thank you, Mayor and Council. So my question is about the historical tax credits. Besides the $2 million or whatever $1 million that you get out of it, what are some additional benefits? Or is that the sole benefit of having it registered and having this historical denotation? So what are some other benefits that we might accrue by having it, having that?
Yeah, so Councilmember Joy, I mean, obvious is, the money. It gives us an additional revenue source, to do things in the building that maybe need to get done based on whatever council direction we get. It's part of a National Historic Registry building, we would get that designation and that distinction. As far as anything else, I don't know if Councilmember Gulick, if you could.
Yeah, I mean, most of the projects we've worked with are pre-World War II, and so, some of when you are working, you're using some of those funds to help restore, rehabilitate, things that would otherwise not be done. In this building, a post mid-century modern, there's not going to be probably as much. There'll be, I think, probably the entry with the mural there, the bas relief sculpture, that might be of interest to the National Park Service. And so probably not as much as we see in a lot of other historic buildings in terms of what it means. I mean, I think it is an example of what was done in 1960, and having that be designated and has probably some value, but I think financial value is what the main thing to see.
Thank you very much, Councilmember Boyette.
Thank you, Mayor. Jessica, when this whole thing started way back when, we were told we only needed 2 floors in the basement and the county would buy 2 floors. The 5th floor would probably stay empty. The diagram up there showed you're going to remodel all 5 floors. How does that work out? I mean, what's the deal?
Thank you, Councilmember, for that question. That is a good question. That was something that came up when we saw the renderings from the architect. So we had always talked about 3 floors, and then 3 floors for offices, and then having the basement for secured parking. So when we looked at how much usable space was on each floor, we could, based on those numbers that we're at about, 87,000 square feet, 90,000. We could conceivably fit them onto 3 floors. It just didn't make sense for the size of the departments, right? So you might have multiple departments that would have to be split between floors. You wouldn't be able to put all your courtrooms together. You wouldn't be able to put certain things that needed to be together. And so that's why we ended up with sort of these unused spaces on each floor, which John touched on. That is something on the next iteration that we are challenging the design team to say, let's try to consolidate some of those unused spaces so that it could be a used space, whether it's a tenant or for some other purpose. But it's just once we got into the building and how you actually can use the building and start laying out spaces, that there's just certain challenges with that building, with the way that, where the lobbies are and where the elevators are and where the mechanical systems are and where the columns are, that we couldn't fully utilize all the floors maybe how we thought we could.
Follow, Mayor.
Please.
Well, one of my selling points is that we could have this building for the future. Now it doesn't seem like there's going to be any room left over, much less for having someone else rent some of the space. What do you think?
So, Councilmember Boyette, we still end up with 38,000 or so square feet of unused, unprogrammed space. and that doesn't include the county space. So when the county moves out, we'll have that 17,000 square feet as well. And then we also have the 38,000 square feet right now that could be used for tenants or could be future growth space for departments. So I think we still have enough space for the city. We're just not at the point where we could give 2 whole floors away.
But Jessica, that adds up to about a floor and a half. The 38,000 plus 17,000 is still more than a floor and a half.
Correct, Mayor. Yeah, 38. Yes, we're at 38,000 about. And then on the 3rd floor here, the county isn't accounted for. So there's 11,000 square feet net usable left over on that floor, not including the county space. So if we took the 37,000 plus the 17,000 that the county is currently in, we still have quite a bit of space left over.
Okay, thank you. Chris, you want to comment?
So I know I'm repeating it, but in summary, yes, there is a haircut here, but not to the magnitude of no, there's not any space. It really is closer to a floor plus some, rather than what we thought maybe was as much as 2 full floors. So there still is rentable space. There still is space to grow into, and we still anticipate that this is going to meet our need for decades into the future. The other thing I'd ask you to challenge us on is, have we grown significantly and how much space we want to use in the building just because the space is there? And I think that answer is no. We haven't. Everybody just didn't expand because we've got a big building. But as we refine and work with the professionals in this, it is a little less than we thought we were going to be. So it ends up being good, I guess, at the end of the day. It's good we didn't sell 2 floors in a condoed situation, but we still definitely want to have some partners leasing space, helping us to offset our cost and leaving us with long-term space to grow into. That will exist.
If I can ask you a question, and then I think a question probably Chris or Councilmember Gulick. You were looking for objective, definable criteria for defining sustainability. And one of the questions on the survey asked the council, if I remember correctly, what kind of a time period would you see as being a reasonable return on investment? And I forget how that was phrased exactly, but it was to be answered in a number of years. Was there some sort of a consensus that arrived from this group on that question? What is a reasonable time period for return on investment?
Thank you for the question, Mayor. That response to that question was really all over the board. I think probably around 10 years was the most common answer. Some said no matter how long as it's saving energy, and some people were more on the 5-year side of it. So I think around the 10-year mark is where most of the surveys landed in answering that question. Okay,
thank you. And then the question for Councilmember Gulick or our new expert, Kevin Ifland. The worst case scenario would be that we get on the National Register of Historic Places and you're somehow confined by those restrictions, but you don't qualify for the tax credits. Is that a possible worst case scenario, or is there a way to condition one on the other so it's a package deal?
So, yeah, I mean, I can start. And so the expert that we talked to out of Virginia was pretty confident that both those would occur. I mean, they would write up the proposal and stuff, and I think, they would give us a pretty definitive answer that, yes, if you get on that, because the National Historic Register is the first step in it. So you've got to qualify for that, and then the tax credits follow. And I think the tax credits is the one that then come with the National Historic Register, kind of tie in there. Is that, I guess?
Follow up with that would just be that the tax credits are received over a 5-year period, and after that, there's no strings attached. I mean, if you do things to the building that change the historic character, that's tax fraud. The IRS will have something to say to you. But being on the register itself does not actually put any limitations on what we could do with the building, unless we had a ordinance ourselves there's no teeth actually to the register. It does elevate, that the building is significant historically, and there are certainly plenty of communities or even states, perhaps, that have opted to put teeth into that. In Billings, we do have 2 historic districts that the Yellowstone Historic Preservation Board reviews changes to historic buildings within that. But there's not, this is within one of those districts, and even so, we have buildings that are being demolished, even though they're in those districts. So.
Okay, great. Thank you for that clarification. Councilmember Owen and Purington and Boyette?
Yeah, thank you. So, 3 things, I think. The term sustainability, I think that's kind of one of those buzzwords that has a little bit of difference of definition for different ideas, if you will. So I think we need more details on that and the cost to achieve some of the things that you had up there to make a determination on what truly is meant by that in this scenario. And I guess I would defer to our architect on this historical tax credit thing, if that is going to impede the way that we present to the public the facade of the building. There was some, I think some of the comments on the survey that had to do with the usability and, what it presents itself to the public. So I'm not sure if you see that as a hindrance.
No, I think anything that we do to the exterior of the building would be in keeping with the historic character of the building.
The 1960s?
Yeah, SHPO is not going to let us do something so dramatic that it's going to change that perception of the historic nature of the building.
So, and then the other thing with your new little bubble up there, the user experience. If you could bring back that one slide that you explained what user experience was.
Actually, defining.
It defines what user experience is.
I think it was back on 6 or 7. Look at that, 7.
Is that it?
All right, yep, user experience. So positive engagement for staff, visitors, and citizens, innovative work environment to attract and retain top talent, provide positive experiences for visitors, be a welcoming destination, and engage with surrounding streetscape and neighborhood.
Okay, so part of that to me almost says the same thing. The positive engagement, be a welcoming destination, experiences, those kind of seem to me like they're pretty much the same thing. Innovative work environment to attract and retain talent, that just means they're not going to be in a closet like they are now, so they may actually come and enjoy their workspace. So I'm not sure, what do you mean by that even?
So all of those fall under this user experience as a guiding principle. So we have these other guiding principles that didn't really touch on these, and these were things that were highlighted from the survey, that a lot of people,
So they just said it a different way.
Right.
Yeah.
So I'm saying all of these things that were reiterated throughout the survey, saying we really want this to be a welcoming destination, we really want it to be a great place to work and to visit, that fell under the user experience as a guiding principle. So then when we're making decisions, design decisions, we're saying, how is this affecting the user experience for people coming to the building, working in the building?
Okay.
Okay, thank you, Councilmember Rowan. And then Councilmember Boyette and Nice.
I just wanted to throw out some assorted thoughts on some of the things that have been talking about specifically to the mayor's question as to payback period. In my opinion, and my recommendation, I think, to the group would be that the package drives the payback. So if you were to come to us with a package of energy efficiency lighting with a 15-year payback, I'd have a problem with that. That doesn't make sense given where technology is. But if you come with a comprehensive system of controls and lighting and sensors and heating and cooling and water reduction, if that has a 15 or 20-year payback, that makes more sense because that's more consistent with the magnitude of potential cost savings. So I would urge the design team to look at all of our options for energy and water savings. I would ask our Energy and Conservation Commission to weigh in and sit with the design team and share some thoughts. There is a state and local technical assistance center at the National Renewable Energy Laboratory in Golden, Colorado that I think will provide a tiny little bit for free and a lot more if you pay them, but can give some insights on best practices for building management and technologies. And I think we should exhaust those resources so that when we look at a life cycle cost effectiveness, we know it's the best technology, we know we've captured the maximum saving, we know we've done what the taxpayers want. So I don't know that a arbitrary number makes sense until we know what the technologies are that are included in there. I would say that from my perspective, we might need to consider any on-site generation separate from efficiency savings. Maybe not, but if the inclusion of on-site solar, for example, drives us to a 50-year payback, we might want to think about those as two separate decisions. It just depends, again, on the technologies. On-site generation might not drive us in that direction, but I would not want the question of on-site generation to be inherent to other more commercially available energy and water savings options. And from my perspective, when we talk about what sustainability means, I want it to see it linked to something tangible for the taxpayer. I want to see it linked to a cost savings. So energy savings, water savings, how we manage and operate the building, heating and cooling, those things matter a lot to me. Whether or not we have, compostable cups and spoons in the break room, sustainable, but less important to me because I can't connect it to something that benefits the taxpayer directly. So those would be kind of my generic thoughts on the sustainability and technology questions.
Thank you. Councilmember Boyette.
Thank you, Mayor. When we toured the building a couple of years ago, we were on the 5th floor and you had a lot of concerns about building on the 5th floor due to some regulations. Are we planning on building on the 5th floor now?
So Councilmember Boyette, thank you for that question. So we are planning on building on the 5th floor. And we do believe under the existing building code, we're allowed to have some assembly space on the 5th floor. Our design team is still working through all the specifics of what that would mean and how that would get approved. The issue at the time was that the previous owner did not permit that. So when they went through the permit process for the asbestos abatement and then the fireproofing, they categorized the 5th floor as a B occupancy. So that meant no assembly space. So it was a design choice that their architect made at the time. And so that was the issue, is that it wasn't permitted as an assembly space, meaning large gathering. It was only permitted as business occupancy, so offices. So we would have to go back through the permitting process and show that that 5th floor meets the building code requirements for assembly space. And I think it can be achievable. It's just a process that we have to go through to get there, to get that approved for assembly space.
Councilor Bernice?
Thank you, Mayor. I sure would like to have this presentation before the meeting so I could digest some of this information, because having it the first time like this, it makes it very difficult. I know the council has asked for presentations before meetings before in the prior councils. I hope this council would agree with that and we get these presentations ahead of time so we can take a look at some of this information. With seeing this the first time, I agree with the definition of sustainability in the sense that it's a long-term flexible use. As far as the energy efficiency and some of that, those are always great things, but I agree with Councilwoman Owen about it really depends on what we're getting and what the payback period is. I think 10 years is a good enough number, but I could probably, extend it to 15 if the payback of the amount we're going to save is longer. As far as You mentioned this, the CM, is that what you called it?
Yep, the construction manager.
Yeah, the construction manager. You mentioned, I think we did this once in the public for the water reclamation. I think it's really a good idea in a lot of respects. I don't disagree with that. Is this is this the first time we're hearing about it for this project?
Yes.
Okay, and the reason I asked that is because from the slide, it looked like you already started doing RFPs on it and acting on it before it was even presented to council as an idea to go forward on. I think that if you had the idea and you start doing RFPs on that, it would have come to us as a council to actually say, hey, that's a good idea, move forward. But here you've already started the work on it before we've even have an idea to weigh in on it, and then say, it's coming to us in March 14th now to give the resolution, I guess, to move forward. I find that kind of out of order, and I would like to see the staff kind of bring council into some of the things a little bit sooner. But in regards to the CM, I'm sorry, I have a lot of negatives, but here's my question. In regards to the CM, is that contract going to include stiff penalties, not just a few $100s here and there, but stiff penalties if they don't meet the timeline? Meaning it actually does hurt them, so they make sure they get the building done in the time that we specify in the contract.
Yes, Councilmember Neese, we will certainly have liquidated damages in that contract, and specifically because we do have city offices that are under leases right now in leased spaces, so it will cost us money if we can't get people moved over there when they need, if they don't get it done and we don't get departments moved in on our timeline, it is going to cost us time as well, or cost us money, so we would certainly have penalties in that contract for timelines.
So penalties equal to what it's costing us in leasing, so that 100% is recoverable from them delaying their work.
Yes, I don't know if we have a legal representative, but I believe we can put up to the amount of what our actual costs would be.
I would be looking for something like that, so thank you.
Thank you very much.
If I may, I'll address your concerns about just timing of this. Because this is a construction manager at risk, we're actually a good time in the process to bring this to council, because if council chooses, hey, we don't want to do this, then the next, the obvious stage is just the regular bidding process, which we would have to be through design. We'd have to have the construction documents done, and so that would come several months down the road. So I don't think we're at too bad of time to bring this to council, and if council chooses no, we don't want to do that construction manager at risk, then we're under the normal process, and we've got some significant design work that has to be done before we bring that general contractor on board too.
I guess the missing the point is you've already done RFPs before the council is weighed in on the decision. And that's where I think that's the problem is it really should have come to council, hey, do you want to do a contract management? We say yes, you go RFP it. I think that's the order of things are a little bit off. Now, we probably will approve that, but it really should come to, my opinion, it should come to council before you act. But thank you.
Thank you, Councilmember Purinton. I've got a question for Bill Haynes. Councilmember Purinton?
Okay, so just as a follow-up to that, Kevin, so whenever that does come to us, we'll have a better idea, because I had the same issue, is out of order, but whenever it does come to us on the 12th or whenever it is, then we'll have a better idea how it's going to cost too, won't we?
Yeah, so I believe it's on the next council meeting. It'll be on the consent agenda just for the resolution saying we can look at this method. And then on the 28th, it will come to council for the actual contract approval. So you're going to see it twice. The resolution approving that we can do this sort of construction manager, that's going to be on the 28th with the actual contract with the contract.
Will
makes sense. And so you'll know, the specifics on the 28th.
So I've been seeing that on the invitations to bid on that RFP. So when does that close, or has it closed?
The RFP has closed.
It has closed.
Yes. And again, so that you'll be seeing that contract if you choose to go this route at the end of March.
So what do you want from us tonight, Jessica? I mean, do you want us to say, yeah, go ahead and do that, or you want us to pick it apart, or I guess we've kind of been doing that.
If you do have any comments on the resolution or on the CMAR process, we certainly be open to hearing those at this time. Mainly tonight, we just wanted to go over the guiding principles and make sure that we weren't missing anything on the guiding principles, or you didn't have any questions, because those are the sort of guideposts that we're using to make the decisions at the staff level and at the design team level. And then regarding the sustainability question, so I mean, to Jennifer's comment about doing all this research and using all these resources, we just want to know that before we go out and do that and expend that time, that's the direction that council wants us to go. You want us to meet a certain sustainability benchmark. Some council members talked about LEED certification. If you all agree and say we want you to pursue a LEED certification, we need to know that so we know what efforts we need to put in to reach something like that. Or we need to be able to come back and say, if you want this certification, this is the process we need to go through and this is what it's going to mean, or it's going to be this additional cost, or it's going to be this additional time on our schedule. So that's the sort of direction that we need. How much effort are you wanting us to put in, and what are we achieving?
Okay, that's going to trigger a lot of response. So before we go down that path, I'm just going to go to Bill Haynes with a question on the tax credits. Maybe it's because I was born in 1960. I don't see this building as being old at all. And I question its historic value.
Whether we want to have our name putting it on the historic register.
Yeah, exactly. It's never been my favorite building. Let's be blunt about it. But I recognize it is rather typical of the 1960s. And I'm not opposed to taking $2.5 million by any means. But my one particular design concern with the existing structure is the way that the primary existing entrance on the east side is hidden inside a cave. The overhang. Is it, by going down the registry path, are we going to have to live with that overhang for the rest of our lives and have to enter through the cave? Can you comment on that very specific design element, or is there a way around that? What I perceive to be a problem, and maybe I'm the only one.
Bill Haynes with Collaborative Design Architects. My impression would be that if we were to nominate the building for historic registry, that those canopies would be a defining element of the building that is indicative of early 1960s, mid-century modern. So my opinion would be that those canopies would stay, but doesn't mean that it would be entering into a cave. We could do some things to enhance those canopies with lighting and direction, signage and things like that to improve that user experience that we're talking about. One of the great things about this being a kind of a great ground floor entrance is that we can dedicate part of this space, the tenant spaces that we're talking about, to be some sort of a public space, either a commercial tenant or something, so that we would have the energy on the street level that would kind of wipe out everybody's impression of this building right now, which is this monolithic white block that represented the federal government. I think we have that impression because the building is not, transparent. It's not inviting for people to come into the ground floor. There's ways that we can do landscaping and lighting and signage and those things that do not violate the historic character of the building, but that will improve that public engagement, that user experience that we're talking about. I don't know if that answers your question.
Yeah. Wasn't ideal, but okay. That's all right. You're being honest. We appreciate that. Okay, so I saw a lot of hands. So who hasn't? Ed, and we'll go from there.
Ed and Ed.
So to the question, or sort of addressing sustainability and sort of how I would define it. Environmental sustainability is part of it, but I think economic sustainability, getting high performance building is I guess is how I would see it. And so we're trying to give good return on investment to taxpayers. And so, a lot of that I see coming from reductions in both utilities as well as maintenance costs. So making the kinds of investments that don't mean that we have to have a huge facilities department just to run the thing. I think I would add a few more things that are a little more qualitative in nature that require some assumptions. But if you have a good indoor environmental quality, if you have good daylighting, if you have there's lots of studies that suggest that demonstrate that people are more productive in those spaces, that they are also just have more apt to like this, is better able to attract and retain talent. So you could assign some sort of number to reduction of churn perhaps. You also have better indoor environment air quality because you're using materials that don't have emissions. You could make certain assumptions, although it's a little more tenuous perhaps, but on reduced sick leave and things like that. So I think those are also things that I would want to consider. And for this reason, I think we should pursue LEED certification for the building. The library we're in is a LEED Platinum building. It did receive some additional grant funding that attracted because it went to LEED Gold or beyond. I don't know if there would be some additional funding that we might be able to attract going there, but I do think the architect actually was opposed to the idea on this building of LEED certification. He said, it's just paying a bunch of money for a plaque on the wall. What you're actually paying for is ensuring that you've gone through this process. I liken it to the reason we go to college isn't because we get a diploma on the wall. The reason we go to college is that we go through a whole process that we learn more, and once we've done that, though, we want to have the diploma that goes in the wall because that recognizes that we've gone through that process. I would liken the same with LEED certification. So I would advocate that we put some sort of level. It gives accountability to our architect and the contractor and ourselves as a city and decision makers to reach for those goals.
Okay, thank you very much. Councilmember Joy?
Thank you, Mayor and Council. I guess maybe having taken the tour down to Denver, this question came up as we were touring a lot of different recreational facilities around the Denver area. And the question came up about LEED certification, and there were some really beautiful facilities there that looked super efficient and high performance. At some level, is it possible to achieve, this particular library is LEED's Platinum, but there are different levels of LEEDs. Is it really, maybe this is definitely an architecture question, is it possible to achieve, say, LEED's Gold without the same types of investments that it would take for a LEED's Platinum?
Ed, you want to?
Yeah, sure.
Yeah, I think so. It's somebody, architect.
Yeah, Ed and Bill.
Yeah, we've done LEED. It is a hallmark of ours that we have 13 LEED Platinum certified buildings and 1 LEED Gold. We've typically done that within typical building budgets. We have done some unconventional systems to get there. We, for instance, collect all the rainwater off our roof, but you have certain offsets where we got a smaller meter from the city, and I would say let's not dictate what it is. Let's make sure we're meeting the life cycle cost criteria. That's probably what would guide rather than. But if we find yourself, what typically happens in teams is you find yourself close to a threshold, and it's sort of like, well, if we just did a little bit more, we could be LEED Gold, or even a little bit more, we would LEED Platinum. So, but I think that the life cycle cost would be a good guide for
Okay, thank you very much, Councilmember Boyette and Councilmember Neese. Councilmember Boyette?
I was working banking and we built some LEED buildings, brand new buildings. The owner went back and said, boy, we're a LEED building. And then the people inside, I talked with them and they said, we don't like it. It's cold in the wintertime and hot in the summer. And we wish we just had windows that opened instead of all of this fancy stuff. So, I mean, I understand the idea behind LEED is probably more efficient. I think I'll agree with the CM here, architect, that maybe on a brand new building it might be good, but on a used old building, I'd like to keep our costs down and make it efficient to work the way it is. I'm not a big fan of LEED, only because I've worked in buildings like that and they weren't user-friendly, in my opinion.
Thank you very much. We'll get comments, I'm sure, on that later. Councilmember Neese?
Yeah, I'm going to agree with Councilman Boyette because I was going to lead that too. I agree with that. If the architect says not going LEED, then that's not going LEED. If there's areas that we can be efficient and a cost benefit is there, I'm not opposed to that. But you know, to actually chase the LEED status, if we happen to get there, apply for it and see what we get. But if we don't, that is not a priority that I think we should have in this building. Is building it. One of the things I do want to ask you about the building is when you talk about user experience. I've been to some city halls, and they look just like our building now, in the sense that it's just so clean and sterile, and just not something that you want to really have. I'd like to see that lightened up a little bit. The ones I've been to that I appreciate is more green grass, park benches to sit in, things like that, where you feel like you're kind of separated out from that. Some trees that you can sit around. So we're kind of in a street. We're kind of bound in there, but there doesn't mean that there can't be some design. Where we maybe bust up. I'm looking online where we got huge wide sidewalks, so you bust up some of the sidewalk. We have lots of street there. Maybe we can encroach into and make areas of sitting or parks or something like that, where maybe not park with slides or something, but benches, something that where people are waiting for their court date, they can go outside and sit. So those are the kind of things that I think that as far as the user experience would be, I would like to see more of that ability to where they feel that they can come and sit and relax, and then it's time for their appointment or go see someone, or they can then move into it. So that would something I'd like to see us do within the building, at least the outside.
Thank you. Councilmember Rupsis, Councilmember Owen?
Thanks, Mayor. I would actually like to see us go for LEED Platinum or whatever, as long as it means we can tear down those canopies, those wavy canopies. If that's the trade-off there, then I'm willing to do that. I think the specific LEED designation should not be decided from the start, but based on whatever kind of payback we can get on whatever type of efficiencies the architect can get. But primarily, I wanted to ask a question about the construction manager at risk program. There's a lot of benefits for the city there with that guaranteed maximum, especially in today's climate. But of course, that construction manager is going to make sure that it's reasonable for them to get under that maximum, because they're liable. What's their incentive to get more than $1 under that? Or are we just saying this is the total amount we can spend and here we go?
Bill has more experience with this delivery method than I do.
In addition to the GMP issue, the primary advantage of this process is really speed and being able to get good cost information early to the design team. As you know, Dowd, I've been hearing costs on construction is increasing. So the longer you wait, the higher costs are going to be, and the more of a challenge it is going to be for that construction manager to keep under his GMP. It gives the contractor some flexibility to make minor changes. So in other words, moving money from one bucket in his contract to another in order to still maintain under the GMP. So it kind of incentivizes innovation and cost savings. So that's why we have been recommending this process.
Go ahead.
But, so we should expect to spend every dollar of that maximum price?
I would say yes, and what we're going to do is be avoiding change orders.
Thank you.
Can I add a question to that same?
Sure, go ahead.
And I'm sorry, asking Debbie as well. My impression is that we've been using this method for most of our significant projects, both for the last 10, 12, 15 years of my career, that we had to go through this process. And now that's not every renovation project, but when it comes to building water plants and wastewater plants and libraries and, huge airports, that this has become the go-to model in the system. But maybe I'm misspeaking, and I was kind of curious. I mean, I assume you pay some attention, not total of all of our things, but is that, I'm seeing this more and more, including in what local governments are doing.
I would agree with that. Most of the major projects, the state of Montana kind of brought this to an issue probably about 15 or 16 years ago for state projects, and pretty much every school district that's doing a sizable project or any other government agency in Montana is using this process.
Okay, Councilor Gulick?
Just to follow up on the guaranteed maximum price, almost always when that's the method we almost always use as well. We're doing much smaller projects than this, but there have been, the other benefit is that there's an open book. And so that means that there is transparency. As an architect, the architect's going to be able to review all the costs, where they are. We see where things are at. I have been on one project where the guaranteed maximum price wasn't reached also. And I suspect in this current environment, the guaranteed maximum price is going to be probably quite a higher, just because they have to have a much bigger contingency. But I've been on a couple of projects, well, one project, I guess, where the contingency wasn't fully spent, and that gets refunded back to the owner, whatever's left. Again, that's been very rare, but that's how all of our guaranteed maximum. Frank is shaking his head, but if you actually look at the guaranteed maximum price contract, it is open book, and you get your money, the remainder back.
Thank you very much. Councilor Rowan,
I have a question about user experience, so if there's more CMAR questions, I don't want to disrupt the conversation.
Don't see any.
Okay, so I wanted to ask Jessica a little bit about kind of following up on this concept of user experience, particularly as it speaks to the Law and Justice Center. So I know you've been meeting with user groups, and I'm curious as to who the user groups are in the Law and Justice Center. So there's a lot of populations that are coming into court. Some of them are crime victims. Some of them are attorneys who are not affiliated with the city who need to meet with their clients. So who's the user group that's informing sort of how the courtrooms get built out, how the law area gets built out? Who's speaking to that?
So far for our user groups, it's all been city staff. So it's been the city courts and legal department. Our design team does have somebody who specializes in justice facilities, and so they've been a big part of that conversation as well for how to design the spaces for the courts.
Is there any thought about sort of soliciting additional users to make sure, that people have places to meet with their clients, that there's trauma-informed places for crime victims to come in? Are there any thoughts about that?
So we did have conversations about that with the courts group, about having these sort of breakout spaces where attorneys can meet with their clients prior to court, because that is an issue right now where they just kind of have to meet in the hallway. So that was brought up as, hey, we do need some of these spaces that maybe aren't used for city staff, but can be used for visitors that are coming, if they need to have a private conversation with an attorney, or and then also having, when we're talking about the legal department, and then the courts, and having different entrances for, say, crime victims versus the people that are coming to court who.
Thank you. Yeah, thank you. Councilor Purington?
So back to the user experience also, and Roy touched on it, and with former council member Ewald here, we had talked about blocking off that street. I think I put that on my survey, making it more of an attractive place for gatherings, if you will. And I do like that. I mean, I don't know that that's an initial thing that we need to do, but yet I can see that, down the road, that would be something that would maybe add to the viability of downtown. There was that question about the, downtown and economic development. And my comment was, I don't think that was ever part of the conversation, at least not in my brain. It may have gotten lost in there, but that was not part of it. But I guess, to have it, that's that inviting into the building, and I do, I like that. Some of those other things that were up there, getting back to what I think you're wanting some direction for tonight. Personally, I would like to study the PowerPoint before I really directed staff. I don't know how soon you need that direction, but I would like to look at that PowerPoint and, kind of get part of that survey.
Jessica, did you want to comment on blocking off the street? I'd love to see all that grass there, but there's so little parking around there and other issues. There's got to be some downside to that.
I mean, I know there's been some discussions internally about, hey, this would be really cool. We could have sort of a plaza area and block it off, but I don't know that discussions have gone beyond that.
I mean, the main thing is we've done no exterior design, figured that into the costs or anything at this point. I mean, so that's weighing it against our fiscal obligations here. I think Councilman's right. Maybe it's something that we need to look at a little bit later because none of this has been even considered into the cost of this project.
Okay.
And I would just add, and you hit it, I wouldn't ever take off the list closing that street. One of our challenges in the near term is going to be parking. It's easy access customer parking. And using that street and changing its configuration, keeping it two-way, creating more two-ways, but is there enough width? I've asked Public Works to double check, is there enough width to put angle parking in? Because we really need to maximize the on-street parking, in my mind, within a walking distance of that building, period, at least for the next several years, because to move in there, we got hundreds of employees to move in, we got fleet vehicles to deal with, and customers who are gonna wanna get into the building, so.
Okay. Councilmember Rupsis, Councilmember Joy?
There's a parking garage right across the street. I don't think we need to conserve parking. I get what you're saying with like the construction in the short term, just getting stuff in, but long term, I mean, there's a parking garage right there. I don't think we need the extra on-street parking that's 6 or 8 spots. I don't think that's going to kill us.
Councilmember Joy?
Thank you, Mayor and Council. I guess I'll just make some general remarks. I guess it was however long ago we started this kind of endeavor with this building that I kind of got to the point where I was like, don't worry about it. How can I come to embrace a brutalist architecture? And so, I have completely changed my mind on this building. I love it. I think we can do rainbow colors. Really, seriously. We can show lights on the exterior. It's white. It's like a canvas. We can do things to the exterior of this building that are not permanent, that don't change it. But by use of light, there are so many things. It is like a canvas that doesn't need paint, but it may need lights or something else. I've really just come to embrace it. And I do kind of follow some things. And around the world, brutalist architecture is now the new in thing, and it is being saved because no one wants to lose it. So I imagine visit Southeast Montana and visit the only brutalist architecture building within 500 miles. Why not? If we embrace it, if we make it ours, if we say this is part of who we are, then it can be an absolutely wonderful experience. So I think I backed off. I was like, oh, the big, huge white, I've changed my attitude. I've decided to embrace, and I think it has a lot of possibilities. In terms of the sustainability, I would like us to get as sustainable as we can. I don't know what that means in terms of LEED certification, but I would really like us to push a little boundary. I mean, really push at getting us, and I think LEED certification, as kind of the way I think of it, is more of a mindset than an actual thing that you're trying to achieve, but more of a mindset. What is possible with this building? What can we do with this building? I think that type of mindset can get you much farther to where you really love what you're doing. And saying, what's the barest minimum we can do, can often get you to what you can live with, but not what you love. And I don't think that anyone in this community wants us to have a building where we said, well, that's what we got, instead of this is what we love and this is what we've made. So I think it's a change in mindset more than it is maybe a particular color or metal or whatever. In terms of user experience, another thing that I've seen is that user experience is a very important category, and I'm glad that it was added to the goals and kind of the ideas that we're moving forward with. Retention and having great workforce is very important to the city. We really do have great employees, and I'm sure they will be very grateful to not have to be in closets and very confined small spaces. But it's more than that. How do we make this building so that it is what people want, not merely we're no longer in a closet experience. So I do know that in a lot of buildings now, there are spaces that are not cubicles, that are not spaces that are simply meant to for a person to work in, but they have open spaces where they can work in a more open space. So I think there's a lot of possibilities. I've seen in workspaces where people can stand and do their work, computers that are away from a cubicle or away from coworkers where they can do work, still be productive, but not necessarily have to stay in the same spot for 8 hours a day. I think that workspace has really been moved away from where you can do work outside of your little department space. So I think this is a great move forward. I'm very excited. I can't wait to see what comes next in this process. And so, gosh, who knows? I do think there will be people who will come to Billings, Montana. Like I was in this library and someone was walking around. They were down by that little fountain pool. And the woman said, there was a husband and wife and another seemed to be husband and wife. And the woman said, and this is our building. This is our new library. Can you believe it? And the people were from out of town, and people were coming from out of town who had people, family or whatever here in Billings, and they came to visit this building. And they walked in and they said, look at that wood. It's so different. I've never seen that before in a library. That's what we can create. We can do that if we allow ourselves the creativity and the freedom to do that. So I think that we will have people who will come and say, look what we did with this. This is where our city does its work, and that's where we want to be. So thank you.
Thank you. I think to have the full 1960s user experience, we should just pipe in lots of Beatles and have that required, and then make sure that all city employees are required to wear bell bottoms. I'm keeping mine for a lot of years, so we'll be ready. Council, we want to wrap up, I think, so we do want to have public comment period. Councilmember Sharif.
Yeah, so I'll just toss my 2 cents in here real quickly. Thank you for adding user experience to that. I can hear one of my graduate professors yelling at me in the back of my head for not thinking about it and asking that it be included earlier. I think that's a very, 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 very important aspect to the usability and how happy people will be with the building going forward. In terms of the energy efficiency, building efficiency, all that kind of stuff, without data, it's hard to make a decision, obviously, and you guys are trying to nail down and not have to look at everything, which I understand too. Personally, I think it's going to boil down to we're going to want as much of that as we can afford. The way I would start doing that process is shooting for a platinum lead and see what happens as we do it. And while I understand the comments about, being in lead buildings and whatnot and what happens with them, we've gotten a lot better at building these things over the years. It almost always boils down to airflow, and the more open the floors are, the better that all kind of works out. The buildings I've been in that were absolutely horrible for that, had a whole bunch of little, offices, anyway. So as much money as we can afford on that, I think, because ultimately, the bills that we won't be getting in the future are going to be used for something that we need to use on something else. And I've forgotten what the third question you had was.
Historic tax.
So the historic tax credit is the one that we really.
Well, as I said when the mayor brought it up, I'm not sure. I haven't made the journey that Councilmember Joy has, so I'm not quite sure that I really want to have my name on a brutalist building as somebody who helped make it a historical landmark. But at the same time, again, money talks. So if this can buy us $2-3 million worth of additional stuff, then in my opinion, it's worth the effort.
Make the mayor love it.
Just sign it with my eyes.
Yeah, I'll get used to it. Okay, Councilmember Nisa, was one other, do you want to do the wrap up here?
Well, would we be the first brutalist historic building?
Yes, we
All right.
will.
Yeah,
Yeah.
gotta be.
No, that's the only comment.
Okay, all righty.
All right.
Yeah, I'm sorry, Councilmember Healy. You got the last word, we'll open up for public comment.
Okay, all right. I'll try to be respectful. So I think on the street, actually, the input I gave to the project team is that I really want this to actually not be, there are a lot of government centers that are just end up being with windswept plazas. Nobody's there except people who, don't have a home. And to create I want to create a lively street environment. And so how you do that, I think, is part of it is you have engaged the facade, not just at the entry point underneath the loops there, the canopy, but having some of our departments that do have a public interface, also having entrances out there, having plaza, a patio, having a coffee shop or some sort of eatery, something to start giving us some street life there that you get people walking there. Actually, it's rare now that it's being advocated to close the streets from in terms of trying to keep life on places. Again, there are a lot of sort of large windswept plazas that just don't end up getting people and keeping it as a two-way street tends to be more successful. The only exceptions of those are like large university towns like Pearl Street and Boulder. But you see, if you go to Helena, you see Last Chance Gulch, just where they close the street off there. It's just not been very successful. And I don't think we want to replicate that here. So.
Okay. Yeah, thank you. And we haven't really talked about it, but I think we would all agree having retail street life is absolutely essential in this building.
And coffee shop.
Coffee, and more coffee.
Two of them.
Kevin, and then we'll open it. And we've got two, Kevin and Jessica, and we'll open it up.
I just wanted to make sure we just got an opportunity. We got Nick Limbert, our project manager, online, and I think that a couple comments from him would be very relevant at this point, maybe, or just some.
That's great. Jessica, is that what you wanted us to focus on?
Yes, I was just going to ask if Nick could say a few words before we open it for public comment, specifically just regarding the topics that we've been discussing here.
That'd be great. And Nick, can you just clarify for us kind of what your role is and also how much of our discussion you've been able to see, if all of it or any of it?
Well, again, Nick Lipper with JLG Architects. Can you hear me okay? Just want to make sure. Okay, great. So I've been here for the whole entire conversation. It's been fantastic. It's been really good to summarize. I've had the surveys up on my screen while I've been listening here. So someone's been a reiteration, but someone's been just more reinforcement of this conversation, which is great. So I think kind of the big three that we were talking about today, maybe start out with the sustainability piece. You know, our process is really, we try to not treat sustainability as kind of the syrup that you put on top of pancakes, right? In some sense, we try to treat that conversation as if it's like baked into the meal itself. It's something that is just kind of inherent, and like was discussed before, kind of that process to get to that sustainability goal is the key here. It's kind of the journey, not necessarily the destination for this project in specific. However, there's a couple challenges with that, right? So we are dealing with an existing building with existing systems that some are past their life, some are going to be difficult to achieve sustainability metrics with those. That's kind of a challenge on us as the design team and the building committee to bring those options to this group and discuss what's happening through there. So, you know, it's not exactly a new building where we can kind of just inherently within the design process just kind of develop these solutions going forward as if they were new, because anymore energy code will get us to a lot of those sustainability goals. But with the existing building, we're almost kind of starting below benchmark a little bit on a few of those systems. So something we'll have continuing conversation on. And then, yeah, exactly. A lot of those conversations about the user experience. I very much appreciate the notion of, hey, let's, especially on the law and justice side, let's maybe reach out to some of the user groups outside of the city staff. That's a great note. That's something we'll take heed, and I think we'll definitely reach out to some other groups around the community once we have more developed plans going forward. So that was a great comment going forward. Yeah, I think other than that, we're excited to hopefully bring a construction management partner on board. Again, some of the key points with the construction management process is, number one, is that open book as something we can dig down to, you know, how much they're spending on the job trailer and the porta-johns if we need to. But it develops a relationship with the design team, with the owner, and that construction manager as a team going forward. We're really not at odds. It doesn't, nobody's hiding anything. We can really work as a team coming together. So very excited with this one in specific because it is kind of a fast moving and interesting process. So, and I guess the last one would be historic tax credits. Again, excited to potentially look at this. My recent experience with historic tax credits is sometimes they spend their money or spend your money for you just in the nature of those tax credits. But I guess going forward, if we do have that amount to bring to the project, I think is definitely worth looking at. And like Bill was saying too, I think just the scope that we're discussing with the project right now is probably not going to limit what we been going down the pathway to what these tax credits might mean for the project. So definitely great options. Looking forward to moving forward with them. So I guess any questions from you on here?
Yeah, any questions specifically for Nick? Councilmember Gielich.
The only thought is, I mean, my thought in terms of the mechanical systems is that we wouldn't be using what's the 60s or 80s or whatever technology is in there. In terms of looking for long-term value for the mechanical systems, like if we're looking for life cycle cost benefits, I think we need to be looking at new systems. Well, I think we should be looking at a life cycle approach. I think that will suggest that we have new systems.
Right, and I think yes, and something I think if we can develop that process going forward and those solutions, I'd like to agree. We just need to balance what's there and what we could use potentially, what is worth using and what's not going to kind of hinder the project going forward. So very much a good point.
Okay, Councilor Neese?
Thank you, Mayor. I think I'm going to disagree with the comment, just so you have another council member.
Got a good balance now?
So you don't think everyone agrees with that, but I am more as apt to, in the future when that device or that cooling, whatever it is, has to fail, then we can replace it with something that's more efficient and energy efficient. But in the meantime, I don't think we should just willy-nilly say, hey, we're going to put everything new in. Let's use what we got. If you think it's going to fail, then maybe we should replace it so we don't fail. But that building is redundant, so if something does fail, you're going to have plenty of time to get it replaced. So I think that was one of the reasons we looked at that building, was because even though it had older equipment, maybe not as efficient, we knew that if something did fail, we would have plenty of time, because we have other systems in place and redundancy there, to go ahead and move forward. And that point in time, upgrade it to the more efficient side. So no, I would say let's focus on more of the user experience as far as what we have developed the building and get that. And then if we have to replace some of those other things later, let's do it that way.
Yeah. Okay, that's very well heated. I think the temptation for saying let's replace it all now is likely because there might not be a better time than now when there's nothing essentially in the building. That being said, the systems are operating. They're operating well. There's a handful of pieces of equipment we know have some deficiencies, but with relatively minor work, we could get the system back to 100% where it's at. So yeah, those metrics coming forward, we'll definitely be working with our MEP group to determine those.
Thank you. Councilor Puritan?
Well, I just didn't want Roy to be hanging out there by himself, because I would agree with that. That was one of the big pluses for this building, is the redundancy.
Okay. Yeah. No. I think the only rebuttal is necessary. It's just a math problem.
No.
It's just a math problem.
Because there's also the cost to, if we have to put in if we're not to replace the system when it's all occupied and we lose the use of that space for a certain time period and the churn, this is the best time for us to be replacing but again, it's a math problem.
It all depends on the factors that we don't know. It all has to be factually specific, and there's no right or wrong answer to that. So okay.
I would say in our design process right now, we've kind of wrapped up that pre-design phase where we've talked about the programming, had the initial user groups pulled together. We kind of understand the space, square footage of what we're going on. This next phase, the schematic design, that's really when engineers are deep diving, and a lot of those kind of system goals and things will be coming to the top. So stay tuned.
Let's open it for public comment. If anybody would like to comment on this item, please come forward. Those few of you who are left, have at it. Anybody who'd like to comment? Frank, you're loud. Okay, I'm not seeing anybody. Locally, do we have anybody online? We don't. Right? So, okay. So we'll close the public comment period then on item number 4. Thank you very much. Go to general council discussion before public comment on non-agenda items. Any items of general council discussion?
What were we going to do? Were there any highlights of upcoming?
Oh, I apologize. Yeah. I skipped right over that one. Sorry. Thanks for catching it.
Can I also quickly, as I'm kind of as we're nonverbal communication between the three of us, I just want to kind of wrap up that last conversation to make sure the way we're taking it is consistent. So the first question, which was, we added that user experience to the kind of value system that we run things through. I didn't hear anyone say, no, that's not important to us, or strip away any of those other priorities. So I think that's a good add. Thank you. And we're going to approach it that way. To the sustainability question, one of the hot topics, it really is a math issue. I'll use loosely, not being an architect, but an administrator, kind of life cycle cost and understanding what it costs. Should I replace my car and get the more efficient one? Or I'm enjoying no payment. Do I take on a car payment because the efficiency just just makes sense? So we will research those and approach those for you to have and us to have choices as to what it is. And we didn't hear a clear, some organization, yes, lead X is what this building will be. What I heard is we're not opposed to being lead something, but that in of itself is not the value structure by a majority of the council. Some yes, but not collectively. So that, anything else? So then the third one, which frankly is one of the most important ones from a time sensitivity, is a historic tax credit. And it frankly kind of ties to the last one. Can't really afford to leave $2.5 million net on the table if there's a way to get, and so I think what I heard is we need to take the next step. We need to get the state office, have some more conversations to get more comfortable with just how limiting is it going to be to walk down this path, how time consuming might it delay things, and is there a risk that we actually do all this and we don't get the credit? What does that look like?
I think that's a good summary, Chris. Taking the next steps, although I don't know anybody would say we're ready to pull the trigger on any of those things, but taking the next steps. Councilor Neese?
Well, I think I'd like to make a motion to direct staff to move forward on looking into and applying for the tax credit.
Without taking the next step of research.
I think I've heard enough here from Gulick here, Councilmember Gulick, and that it's there's no real downside. Like Councilwoman Joy said, a brutalist. If it becomes historic brutalist, all the better. And so, I mean, it's a building. And there's lots you can do with it. So that's my motion. And if there's a second, we can vote on it.
Okay. Is there a second? Second by Councilmember Tidswell. Discussion on the motion. My obvious point is it's premature to pull that trigger, so I'll vote against it. But I'm not against it long term, depending on what research comes out. That's the only other argument. Any other discussion generally? Councilmember Boyette, Councilmember Purington?
And that was my concern. I'm not against it, but I want to have more information. Is there something a pit that we haven't fallen into that's coming up that we don't know by going ahead with that? Does it stop things? Does it make it architects can't move forward? Can construction not go forward? I'd like to have more information before we would vote on something like this to make sure we're not having some problem, because there's always a pitfall. There's always one.
Councilor Purington?
Well, the thing that just stuck in my mind, what Nick said, was they like to spend your money.
Right.
So who's they and how do they spend our money? And this is $2 billion approximately over a 5-year period of time. And then after that 5-year period of time, do you still get something for that, or is that then you're done?
Yeah, my understanding is, after that payback period, then it stops. I mean, your payment stops. You don't continue to get.
And we could tear down the little wavy thing after that 5 years.
No, because that's the historic thing.
We have to edit out all the pictures.
Again, there's got to be pitfalls.
So do we have to pay for that in order to get it? I mean, it's always that, nothing in life is for free. So
pay
what do we
in
pay?
the fee to the broker and then to the fee to the First Interstate Bank, for example.
It's why it was important for us to talk the difference between gross and net. And we talked about them loosely because we don't, the percentage was talked about as a range, but don't expect to get a $3 to $4 million net. But the net did seem, after the conversation, after they get their fees, that you still are $2+ million to the positive.
Okay, any further discussion or vote on that? Councilmember Trickey?
I just want to point out that I did a real quick web search, and there is a brutalist building in Connecticut.
It looks just like ours.
And it looks exactly like ours. And
Ours was made first.
retrofitted to be a hotel. And it's actually like all the top energy efficiency things, but that's a money thing. And it's on both the state and national historic registry.
And the name of it is, for everybody who wants to.
It's now called it was the Armstrong Rubber Company building.
Oh, there you go. All right, ready to vote on the proposition? Okay, if in favor of the motion.
Can you just repeat the motion again?
So the motion is to direct staff to move I'll call it full speed ahead with the pursuing registration, and I guess not have to come back to council further. The alternative being a more incremental approach, whatever that means. Okay, so if in favor of that, of the motion, say aye.
Aye.
If opposed, say nay. Nay. Okay, we have to do it by hands. If in favor of the motion, raise your hand. Voting in favor, 1, 2, 3, 4, 5. If voting,
Hold it.
oh, 6. Okay,
Six.
okay. If voting in opposition, raise your hand. 4. So the ayes have it. Okay. So anything else in the way of?
Thank you. I'm sorry. There were 3 things, particularly the last one, to know not pursue or pursue at least to the next level. So thank you.
Okay. All right. Well, that then concludes item 3. We still do have item 4, Chris.
So I'll be brief here. It really is about land use. So you've already had your package. You've already given us some questions. You know, a week from tonight, you got a couple of significant land use
Actually,
issues.
6 days from tonight.
Yeah, I'm sorry. Thank you. 6 days, not 1 week. You got a couple of significant issues there, impactful issues. So thank you. Questions have been coming in. Staff is responding to those. So that's the primary thing I wanted to point out near term. As far as thinking about the retreat, we're making progress there. Thank you. I've tapped a few of you to have you weigh in on the agenda as we're refining it. And I'll tell you at a high level, the idea of looking at, so I'll give this to you again, is those 5 strategies I've been preaching around the community for a couple of years, building a high performance organization, improving safety, improving the built environment, investing in infrastructure, and improving our quality of life amenities. Part of the feedback has been, instead of just creating priority lists that aren't tied to strategies, what we're doing is we're just creating to-do lists. But we should be talking at a higher level, and I agree with that totally, of agreeing first on kind of what are the key strategies that we are, and then how do priorities fit underneath of that. So we're moving in that direction. Offline, give me feedback to that. And the idea will be to give you some homework before we get there, so that when you get there, we can have as productive as time will allow us to have in that a couple of half-day sessions. So those are kind of the precursors here in the near term.
Okay, thank you very much. Some questions, Councilmember Deans, Councilmember Boyette?
Speaking of the next item agenda, it's expected to be a lot of people here.
Yes. Yep. Yes.
I think I talked to Gavin a little bit about that. He said he's going to have some live pods that people can go to, and so that'll be nice. We can fit a lot of different people and have to have people coming and going. But if you could have the staff here to present instead of on Zoom, that'd be very helpful. And then maybe if we can set chairs up here to give the public more room, have all our staff back here, I think it would really help the public get in this room and be able to hear live, face to face what we're seeing. Because the more we can see the public, I think that's important. So thank you if you could work on that.
Sure. Councilmember Boyette, Councilmember Joy?
That's what I was going to bring up. I went through the zoning meeting. There was 60 people, and I think there might be that many or more. So as long as you're aware of that and how to put all of them here and inside and outside, just as long as you're aware of it, which you are.
Okay, Councilmember Joy?
Yes, and my other suggestion is we use the wireless maybe so the numbers are bigger, because I'm not sure how big 3 minutes appears from that podium over there. I don't know, maybe the wireless is not, but, or move it closer or something, I don't know. It's just so people can see that their minutes are ticking away, and that's sort of a distance in there, whatever.
Okay, Councilmember Erickson?
Just a quick question. If there's going to be that many people, I know that you have the prerogative of making it 2 minutes instead of 3 minutes, and then the lineup for and against, and they say the same thing, have the same issues. I don't know if you want to deal with that or not, or just let it go.
Yeah, it rarely works to have all, there's no real time savings, just do one or the other, but certainly good to remind them, try to say something different if it's clear. And if you guys want to go to 2 minutes and maybe It all just depends on how many people.
And comments.
And I mean, I don't have any problem if that's your preference for 2 minutes. I wouldn't recommend going as low as 1 minute because it's very frustrating for people.
No, I wouldn't do that. Well, I would suggest 2 minutes. If you have more than 30 people, then, then maybe make that kind of estimation at the very beginning, and then you can say it at the very beginning.
Well, we could look at the zoning commission meeting. There really wasn't that much time at each person. They just wanted to kind of say, too much traffic, I'm against it, and they sat down. So they rarely went too long. There were a lot of people, but my impression was they didn't go that long. So that's probably good. Okay, was there anything else? Councilor Boyette?
And just lastly, the mic over here, this is doesn't work half the time, and somebody's tall and short. Can you have more than one mic to do the same thing so that, because you still can't hear the people unless they stand with the mic right in front of their face.
We need omnidirectional mic. That one there is just.
Work on options there, and that's our next week is our last meeting here. We'll be back at City Hall where we got a better sound system, not as much room.
We'll also change the orientation of that. What I notice is people look to the person who's closest, which is Tom Rupsis.
Like this.
Yes, and maybe they look to me because I'm kind of in the middle of the room, but I'm farther away. They don't look over there where it's pointed, and that means they're cocking across the mic. So we'll kind of try to reconfigure the podium to look more to Tom and me.
No, to you.
Okay. Good, all great points. So I think that concludes that item. So council discussion, any items of general council discussion before we go to public comment on non-agenda items? Don't see any, so public comment on non-agenda items.
Yay.
Catherine, thank you for your patience.
Please look at the mayor.
Yeah.
There you go.
Control the technology.
You got to really turn that hard.
Just take this.
See the problem with the mic though?
There,
Yeah.
that it?
Yep, sound good.
And then it falls off.
Yeah.
I'm wondering if you just comfortable holding it. Yeah, just unwrap it.
Is this even on? All right.
Thanks.
You guys, it's been really good to laugh with you all. And it was a good meeting from a citizen standpoint. Thank you for your work. Catherine Card, 2815 4th Avenue South in Billings, Mayor and Council. Unfortunately, I'm here to complain my role, I guess. But I think this is important. I've written you some letters already and another one this afternoon. My point is for this not to go under the radar for you. I'm here because of the January 15th incident at the Grandstand Sports Bar and Grill involving off-duty police department officer and an off-duty Yellowstone County officer and an unnamed civilian. The three of them had been socializing at the bar and then had walked outside of the bar into the parking lot at 12:45 a.m. A few days ago, there was a video released from the bar's security camera that showed what happened next, and what happened next was really, for me, embarrassing to watch. It was 3 men who appeared to be drunk and looking for a fight out there in the parking lot. Here they were, at least 2 of them, current officers whom we as a community trust on a daily basis to keep order and to keep our community safe from all kinds of danger, including thugs and thuggery, and themselves acting as drunken thugs outside a bar at 12:45 a.m. For me, it was painful to watch, thinking of their families, thinking of their friends, thinking of their colleagues. The Billings Police Department policy manual, oath of office and code of ethics states as its purpose to establish guidelines for ethical responsibilities for officers on and off duty. Goes on to state that the public demands that the integrity of police officers be above reproach, The integrity of police service is based on truthfulness. Police officers must therefore avoid any conduct that might compromise integrity and thus undercut the public confidence in law enforcement agency. It also goes on to say that police officers will behave in a manner that does not bring discredit to their agencies or themselves. The police officer's character and conduct while off-duty must always be exemplary, thus maintaining a position of respect in the community. Work, I believe, needs to start within the local law enforcement entities, Yellowstone County and the Billings Police Department, to restore the understanding that policing and law enforcement jobs are positions of public trust. And that means that everybody in those jobs needs to be mindful of the ramifications of their off-duty and on-duty behavior on the whole community. And if that expectation of trustworthiness by the community is too hard to commit to, too hard to respect for some, then they need to find work elsewhere. Our community of Billings needs to be able to trust those who are carrying out law enforcement among us. Thank you.
Thank you. Well said. Any other public comment?
I was told when I left city council, things would change and you guys would be done by 7:30. Wow. Nothing changes. So, I've been at this podium before I got elected to city council. And so now I got a better understanding of what your positions are out there. That you are responsible, you are elected by your constituents to do the best you can for the city that they live in. And so I'm gonna go over, I wanna thank you for the service that you got, but I'm here tonight to advocate for the initiative that you passed to put in place a cap on the number of pre-releases and parolees sent to Billings. Ms. Dahl sent out an explanation that I just handed out to you all, defining DOC's right to place these pre-releases and parolees following State Code MCA 53-1-202, parentheses 2. Included in her explanation, it states that DOC needs to follow certain guidelines. In pre-release centers, under intense supervision, under parole and probation. Judging by some of the recent crimes in Billings, these pre-releases and parolees have left their pre-release centers with no knowledge of their whereabouts. This means DOC is in violation of following state code. The last published number of these persons in Billings that I saw was 2,600. I called state probation office last week and was told there are 45 parole officers assigned to this area. That means each officer is responsible for supervising 57 persons. This violates the intense supervision clause of MCA 53-1-202-2. In the workplace, the span of control varies from 5 to 20 persons. These persons are usually law-abiding with the goal of achieving better status. The same is not true for the persons under supervision of parole officers, and yet the span of control far exceeds 20. I'm asking you to go forward because DOC is not following the intense supervision requirement to implement a yearly cap of pre-releases and parolees coming to Billings. No one has provided evidence of a state law or code that prevents Billings from doing this. Gookin even said that there was no such law when we had that public safety meeting here in the same room.
As elected members of the City Council, it is your responsibility to provide for the safety of the citizens of Billings and to protect them from the revenue drain caused by the DOC placing these persons in Billings. Only by taking such action will the governing members of the state come to terms of the seriousness of the situation. I am tired of the crime and the direct cost of these persons in our city. A public safety meeting should not start out with this statement. Billings is the most crime-ridden city in Montana. But it did. Thank you for listening, and please take a real stand.
Thank you. Unless somebody wants to go find somebody out on the street to come in, we're done, right? We're adjourned. Thanks, everybody.